Good morning and welcome to the 2020 Coastal Bend Hurricane Conference, a pandemic approach. I am happy to have you here in the Coastal Bend, where we have Chamber of Commerce weather every day and we all get along. So this year we are hosted by the Corpus Christi Port Authority and the Coastal Bend Emergency Managers Association. I am RJ Thomas, President of the Coastal Bend Emergency Managers Association. I'd like to give many thanks to our financial sponsors. Every one of our 9 years, HEB has been there for us. We have 7 levels of sponsorship this year. We have our lead sponsor, which of course is HEB. We also have a Category 5 sponsor, which is the Port of Corpus Christi Authority. They're actually coming over a little bit above Category 5, good for them. Category 4 is Cheniere and Citgo. Category 3 is New Star. Category 2 is Allegiance Mobile Health, and Category 1 is DRC Emergency Services, FirstNet, US Flood, and the City of Corpus Christi, Nueces County, LEPC. Our tropical storm sponsor this year is Crider Gulf. So our conference format has served us well in the past. The Coastal Bend region took a direct hit from Hurricane Harvey. It was a Category 4 hurricane, and there were no direct loss of life due to that. That's a great accomplishment for the region and for the individuals working in the region. The region has not been so fortunate with COVID-19, as the rest of the nation is also seeing. We are now faced with a pandemic. So because of this, Sabima has come together within a shortened time frame and under a new format, kind of like having all the time you need because it's disaster time. We would love to have all of our committed speakers for the May present at this online event. However, we are going from around 60 50-minute spots over a 2-day period to approximately 15 10-minute spots over 3 hours. So things have got to change. Please rest assured we will find some way back to our original type of format as soon as possible, as soon as feasible. The conference committee is focused on 3 areas most affected by COVID-19. They are evacuation, and then there is mass care and sheltering, and finally, virtual coordination. So these are the areas that were picked by the committee and approved by the membership. A very quick overview of how this is going to kind of work. We have an open session, which is what we're in right now, followed by 3 panels. And then there'll be a break in between the panels. These breaks allow you to get up, go to the restroom, whatever you need to do, but they also allow us to recognize our sponsors. So we'll have some interesting information with our sponsors in those breaks. Each panel features a moderator who is experienced facilitator representing the broad interests of the many stakeholders in their area of expertise, as well as one subject matter expert from each of the following fields: emergency management, health and medical, private sector, state agency, and non-governmental organizations. So attendees can submit questions to the panelists. It's at the bottom of your screen, the Q&A there. Time is limited, so what we plan to do is we'll have some Q&A, but we will address all questions submitted in a recap document that will be published after the conference. So we don't want any questions go unanswered just because of time. We'll get to them. Please note this is a live event and is being recorded. So our battle order today is as follows. First up is evacuation panel. Moderator Gary Barney is the Texas Division Emergency Management District Coordinator in District 20, Corpus Christi. He started his career in 1987 with fire service in El Paso, Texas, obtaining the rank of captain on the department. He has numerous certifications through the Texas Commission on Fire Protection, as well as qualifications from the National Wildfire Coordinating Group. Gary has assisted on a wide variety of incidents throughout the state, from wildfires, hurricanes, flooding events, tornadoes, and other disasters, as well as some pretty large events such as the Super Bowl, Formula One, and NASCAR racing. Our second panel, mass care and sheltering panel. Moderator Crystal Lyons is a disability consultant Let me try that again. Crystal Lyons is a disability consultant specializing in ADA Title III, accessible transportation, and inclusive emergency preparedness. She is a member of the Coastal Bend Functional Needs Team, dedicated to making emergency planning preparedness inclusive of the needs of people with disabilities since Hurricane Rita. She also serves on the executive committee for the Texas Emergency Management Advisory Committee, known as TMAC. And third, the virtual coordination panel moderator, Daniel Hale, has served in numerous public safety roles over the past nearly 20 years, including 911 dispatcher, paramedic, volunteer firefighter, regional liaison officer, and emergency management coordinator. Now, as the Port's emergency manager, she works to institutionalize the National Incident Management System throughout the Port community and enhance regional collaboration. During Hurricane Harvey, she helped lead the first activation of the Port's incident management team and was awarded NOAA's highest public distinction for her efforts. As normal, our first presentation in the general session is from our partners in the National Hurricane Center and the local National Weather Service here in Corpus Christi. John Metz is our meteorologist in charge of the National Weather Service in Corpus Christi. John leads a team of meteorologists who provide life-saving weather forecasting and warning to the South Texas community. He works closely with the media, emergency managers, and other local, state, and federal officials to ensure that South Texas communities are ready when hurricanes, floods, and other hazardous weather threaten. He works with he's worked with the National Weather Service for 27 years. We also have Melissa Huffman, is the warning coordinator meteorologist at the National Weather Service. She has extensive experience forecasting and communicating weather information within the state of Texas. Having worked at the National Weather Service for more than 9 years, she earned an MPA from the University of North Texas in emergency management and graduated with a bachelor's in meteorology and climatology. Before we hear from John and Melissa, we'll watch a message from Ken Graham, Director of the National Hurricane Center. Cue video.
Hi, this is Ken Graham, the Director of the National Hurricane Center. Thank you for this invitation today to speak to all of you at the Coastal Bend Hurricane Conference. So welcome. Greetings from Miami. So a few things for the National Hurricane Center, a few messages. First of all, a big thanks. Thanks to the emergency management community for all the hard work that you do to keep everybody safe. Also, thank you to the Weather Service offices in Texas for the great relationship. We work so close together, and we all provide that decision support so you can make those big decisions. So I appreciate that. And I even worked at the Corpus Christi office for a few years, so really appreciate all the different challenges that you have in the Coastal Bend. Well, from the Hurricane Center, there's a couple new things I wanted to talk to you about this year. One of them is, when you look at the cone and you look at our forecast, you're actually going to see a new dot on the map. At 60 hours, we added a forecast point, and that really is to help us calculate the storm surge. And by that, we look at the structure of the storm, we look at the wind radii, and we also look at the forward speed. Those parameters, that structure of the storm and its speed, have almost everything to do with the calculation of the storm surge. So you're going to see that new dot on the map this year. The other new thing is you're going to see a brand new experimental map for storm surge. We have the inundation, we have the watches and warnings, but this is a map to really highlight some of those areas with the highest storm surge. So the maximum storm surge values on one map. So you're going to see that this year. And I think that's going to help out. When you start looking at briefings and social media, it's just a simple, quick way to look at some of those danger zones when it comes to the actual storm surge. So when you look at this season, a busy season, I mean, without a doubt, we're looking at all the different parameters from the African monsoon, we're looking at the heat content of the oceans, we're looking at the upper atmosphere. Everything seems to be coming together, unfortunately, for a busy season. That's not a prediction for landfall. So it's over the Atlantic Basin, including the Gulf of Mexico, more than the average number of storms. So we have to be ready every single year as if we're going to be hit. So that's one of the reminders. The other couple of reminders are very important. You look at history, water. 90% of fatalities in these tropical systems is from the water. The leading cause is storm surge, and then the inland flooding, and the rest is offshore. 90%. So we've got to be ready for all that water. And the other thing is, hurricanes don't care about your timelines. It's such an important fact. We see hurricanes like Florence that give you 10 days notice, but others like Michael only give you 3 to 4 days notice before landfall, and that was a Cat 5. So be ready to speed up those timelines. Once again, from the Hurricane Center, thank you for everything that you do. Thank you for the partnership with emergency management and our weather service forecast offices. Have a great hurricane season and have a great conference. Thank you for all the preparedness, and thank you for inviting me today. We'll be with you. If there's a hurricane or tropical system, we're going to be here with those watches and warnings and forecasts. We're going to be side by side with you to help you make those big decisions. This has been Ken Graham, the director of the National Hurricane Center. Thank you for this opportunity to speak to you today.
All right, can you all hear me? It's great to see my old boss, Ken Graham, there from Miami, speaking to us, an ally and someone that's familiar with the Coastal Bend. So good morning, everyone, and welcome to the 2020 Coastal Bend Hurricane Conference. I only have a few minutes to speak with you this morning to remind you that it's still hurricane season and we live in hurricane country. In fact, the peak of the season is still about a month away. We've been fortunate so far, but you just never know. A storm could be right around the corner and we must be prepared. So first, I just wanted to speak with you about the changing roles at our local office. As was mentioned, RJ had mentioned, I'm honored to serve as the new meteorologist in charge of our local office. We have a fantastic team that is trained and ready to serve you at a moment's notice if a hurricane threatens. I also want to introduce several new staff members, part of our management team. You'll hear from her next, Melissa Huffman. She joined us just this last February. She's our new warning coordination meteorologist and will take the position that I held previously. Melissa, as mentioned, comes with a wealth of experience working hurricanes, tornadoes, and floods. In fact, she worked Hurricane Harvey in the Houston area. She has that bachelor's in meteorology from the University of Nebraska and a master's in emergency management. So she knows how to work well with emergency managers within our community. She's an expert at that. Melissa will be the new voice for our office during hurricane briefings, community outreach, and she'll be one you'll hear from next. Also joining our team on August 3rd is Tim Humphrey. Tim will serve as our new science and operations officer. He replaces Big Mike. For those that knew Mike Buchanan, who would speak at our conference every year about storm surge, Tim will be coming to our office from the National Weather Service in Lake Charles. He also has a wealth of experience in working a lot of events in the Louisiana area, and he'll be responsible for training our staff, conducting research, and collaborating with local academia. Last but not least, Matt Ziebel. He joined our team this past year and serves as our new tropical program leader. Matt helped develop our 2020 hurricane guide and led the training of our staff for this upcoming hurricane season. So some important takeaways as we go into this hurricane season is where to find information during this new virtual environment that we find ourselves in. There's only one website you need to remember. I want to keep it easy for you. Bookmark this on your home computer, on your mobile device, weather.gov. weather.gov/Corpus Christi. If you bookmark that site, then you'll have access to all the information that you need. It's here you can get our forecast 24 hours a day, and especially when a hurricane is threatening, all the briefings, everything that we're providing will be posted right on the web, on social media as well, on Facebook and Twitter. Also on our website, you can download our 2020 Hurricane Guide, and it contains all the information you need to get ready for this season. And if you haven't done anything to prepare for the season, it's still not too late. Things look still pretty quiet for the next couple of weeks. You can also access our new webinar series on our website and learn how to interpret hurricane forecasts and warnings. Also, during this challenging time, we have to find new ways to support emergency managers when hurricanes threaten. So we're not necessarily deploying a meteorologist to emergency operations centers now with the threat of the pandemic that we see and face. But so in order to reduce contact and enforce that social distancing, we're supporting emergency operations centers and emergency managers virtually. So we have meteorologists standing by to remote virtually call into emergency operations centers and assist with any questions that emergency managers may have, and that will help support critical decision making. So I want you to rest assured our office is open. We're here 24/7. We're standing by, ready to support you when a hurricane threatens. I thank you for having me this morning. I hope you have a successful conference. Thank you for everything that you do, and have a safe hurricane season. Thank you very much.
Good morning, everyone. You've just heard about the approaches the National Hurricane Center and the National Weather Service in Corpus Christi will have for the 2020 hurricane season. This season, like the rest of this year, will be defined by adaptation. We're seeing this adaptation firsthand today through the virtual administration of the Coastal Bend Hurricane Conference. Despite the changes it has brought to our region the past few months, COVID-19 will not stop the next hurricane. It will not keep South Texas from experiencing deadly flooding from heavy rainfall or storm surge. It will not protect us from infrastructure damage caused by high winds and tornadoes. It will not stop the need for decisions that protect life and property to be made. Hurricane Harvey recently taught the region a lot about what a landfalling Category 4 hurricane can do, about how the western Gulf of Mexico is a place where storms can quickly increase in strength and intensity, about how small changes in the path of the storm can ultimately affect who sees the greatest impacts, about how timelines can quickly change. But it's not 2017 anymore. What we learned in Harvey must be adapted for 2020. We have a 60% chance of an above normal hurricane season this year in the Atlantic Basin. The potential for storms to develop is high, and the decisions that have to be made in South Texas this year may occur on a much different timescale than in any previous hurricane season. To help with these decisions, the National Weather Service in Corpus Christi will initiate email briefings whenever there is a concern for development in or near the Gulf of Mexico. We will also conduct webinars should a storm reach the Western Gulf or confidence increase for impacts to South Texas. Should a storm approach South Texas, we can provide worst-case storm surge snapshots, as well as chances for tropical storm or hurricane force winds that incorporate uncertainty for landfall location. Despite the challenging environment facing the region this season, the National Weather Service will continue to work side by side with our South Texas partners to adapt and provide the best forecast and decision support possible. Storm surge, flooding rains, damaging winds, and tornadoes. Hurricanes and their hazards will still happen this year, but it will require more than previous hurricane experience to get South Texas through the 2020 hurricane season. It will require embracing our current circumstances to adapt the lessons of yesterday into the new normal of today. Welcome to the Coastal Bend Hurricane Conference.
Hi, this is Governor Greg Abbott. I want to say thank you to the Coastal Bend Emergency Managers Association, as well as to the Port of Corpus Christi for your work on the front lines of hurricane preparedness. Now, as you all know, Texas is in the middle of not only hurricane season, but also a statewide response to the COVID-19 pandemic. Well, whatever the challenge, we all know that preparedness is the key. Texas is preparing for any potential storms that could, however, impact our state. And our agencies are working strategically to mitigate the spread of COVID-19 while also helping to keep Texans safe. So on behalf of the entire state of Texas, I want you to know how grateful we are for your continued partnership as we build a more resilient future for our great state. May God bless you in your efforts, and may God forever bless the great state of Texas.
Good morning, everyone. I'm Nim Kidd, Chief of the Division of Emergency Management. Thanks for being with us today, and it's good to see as many of you as I can. Before we get too far into the program and the presentation, I'd like for you to ask for your thoughts and prayers for the family of Kyle Coleman, the Bexar County Emergency Manager. Kyle passed away last night. Been a lifelong friend of ours. Second, I need you all to stay healthy. We're in trying times right now. I want you to take care of your spiritual, physical, and mental health. Second, I want you to remember to do what we do. We have to plan, train, and exercise together, just like you're doing right now, regardless of circumstance, regardless of situation, no matter how difficult it may be. We've got to stay focused on the things that have made us successful. You've heard from many great speakers this morning, and I know you'll have more the rest of the day, but I want to focus on a few things that I think we as a state need to be ready for. And one is to make sure we have the right amount of personal protective equipment. This is something that we really haven't paid much attention to in the past. We've had it for dire situations, but really masks and gloves and face shields and disinfecting supplies and cleaning solutions need to become more of our routine than ever before. Second, I think we need to really rethink and add more modes of transportation. We've always talked about buses and ambulances. We need to continue the planes, trains, and automobiles mindset and figure out everything that we can do to be ready to order an evacuation early at the local level, but locally and state have the resources available to move as many people as possible in the short time as possible. As we talk about sheltering, our sheltering challenges will get greater. Our team is working with our federal partners to do more non-congregate sheltering than ever before, but that doesn't mean that we should abandon our congregate sheltering ideas. We can still use the same facilities we've used in the past with fewer people in them, with more cleaning in them, and more space between. And finally, I want to thank you for what you do every day. This has been a great time for us. While it might be a tiring time as an emergency manager, it certainly is an exciting time as an emergency manager. And don't forget, everything you do is not only for the citizens of Texas, but for the friends and family that you love. So please take care of yourself, stay healthy, and God bless you all. Thank you.
I would like to thank both the National Weather Service and the Hurricane Center for their presentations. John, Melissa, and Ken, we are well served by you in this area. And I cannot thank Governor Abbott and Chief Nim Kidd enough for their continued support for the region and for the entire state of Texas. It's at this time I'd like to introduce our first set of our first panel. And what I'd like to do is get ready to turn this over to Gary. The evacuation panel is first, and Gary is the Texas Division of Emergency Management District Coordinator in District 20, Corpus Christi. He started his career a long time ago, and I'm going to go ahead and turn it over to District Coordinator Gary Barney.
Thank you, RJ. It seems like just yesterday. Good morning and thank you. I appreciate the opportunity to join everyone this morning and lead this discussion. Preparation for an evacuation in advance of a hurricane is always one of the most challenging tasks our communities are faced with. Local preparedness managers and elected officials must consider many variables and answer sobering questions such as, who is at most risk and must evacuate? Are there some who can shelter in place? Do we shut down our critical infrastructure? And how do we move our most fragile? The evacuation is also one of the most studied portions of our planning efforts. For the past 2 years, our area emergency managers have been engaged in updating our regional hurricane evacuation and transportation plans with experts from FEMA, the Army Corps of Engineers, and the Texas Transportation Institute to evaluate the population data, behavioral studies, and mobility and evacuation routes to determine the best possible outcome given any number of scenarios, from minor storms to catastrophic events. This year, in addition to our normal challenges, emergency managers are challenged with determining how to adapt to changes to accommodate and overcome social distancing. This is creating new challenges by increasing the time needed to evacuate, increasing the number of buses, the number of personnel, and those who need assistance and raising concern as to where people would be placed if they have an active infection. Join us today are 4 subject matter experts working on the front lines to address the evacuation related concerns. We've got Billy Delgado. He serves as the Emergency Management Coordinator for the City of Corpus Christi. He is responsible for the day-to-day operations of the emergency management. His position coordinates the preparation and implementation of the city's emergency management plan. He has worked for the City of Corpus Christi for 30 years. Also joining us will be John Phillips. He is the coordinator for the Texas Emergency Medical Task Force 11. The emergency medical task forces are multi-RAC regions to leverage capabilities of multiple trauma systems. He is also a member of the Coastal Bend Regional Advisory Council. Also joining us will be Brandon Luttrell. He is the Health, Safety, and Security Manager for Moda Midstream Ingleside Energy Center. He is the current president of the Coastal Plain Local Emergency Planning Committee. He served as a U.S. Navy veteran. He is certified by the Board of Safety Professionals as both an associate safety professional and a safety management specialist. Also joining us will be Captain Stephen McQuaid. He serves as the captain of the Texas Department of Public Safety in Corpus Christi, covering 11 counties in the Coastal Bend. He also serves as the chairman of the Disaster District 20. His experience includes 21 years of law enforcement with the Texas Department of Public Safety and 10 years as a Texas Highway Patrol captain. Before we turn it over to our first presenter, we want to bring your attention to the chat feature. Each of you can submit a question throughout the presentation. These questions will be shared in a post-conference frequently asked question or fact document. All right, Billy, you are first up, and thank you for being here today, sir.
Good morning, and thank you for the invitation to speak in front of this group. Today, what we're going to be talking about is the evacuation process, utilizing our function needs support team and other areas and agencies that we have working with us. We're going to focus on the planning process, safety, evacuees and staff, transportation challenges. And I must say all jurisdictions are facing the same issues all over the state. Every EMC and city and county leaders are working on this issue on evacuation and sheltering because of COVID-19. Next, please. Thanks. We'll be talking about the evacuation process again. Next slide, please. Our plan is based on accessibility and inclusion of all citizens of Corpus Christi. Includes the right, you need to include the right organizations. You need to have function needs support team. You need to have the right areas, the health departments, our city evacuation teams. TDM has been very instrumental with Gary in our meetings, and then working with Jeff Newbold and his team for our ETN process. Our communications with PIO and IT and other outside agencies that we are working with as far as our evacuation process. FNST is very, very important. Our plan is based on accessibility and inclusion of all citizens of Corpus Christi again. The plan remained the same, but we had to develop through the year that we have developed through the years, but because of COVID-19, we've had to make some changes in the plan. Our function needs support team has played a major role in this planning process. They are prepared and they know what to do, and they give us guidance on how we should assume our evacuation process. Advantages include the exposure everyone has to various types of disabilities. Better understanding of rights of individuals with disabilities to be treated with the same respect as other in emergency situations. Our city evacuation team is made up of our city employees, and they go through specific training on how to handle the evacuation process. Some of the challenges with this year is, and everybody's working on it, is COVID-19. We have worked hard. We have done a lot of process and a lot of training. The timeline is working very close with the National Weather Service. Transportation is a major challenge, as everybody knows, and everybody's working on that. Social distancing will be a challenge during the evacuation. Again, having the right organization and the early discussion on transportation was critical, such as our Regional Transit Authority, our Corpus Christi Independent School Districts, which we use to transport people out of town, our EMS division of Fire Department, our Texas Department of Emergency Management, working through them, and city staff. More transportation assets will be needed to transport the evacuees and pets. As a local, we know that we need to see what resources we have locally to help support the evacuation. We realize that everybody in the state is the same situation. So what we can do locally, and when I say local, our community is region-wide. We reach out to each other in times of crisis, and we'll continue to do that. And every jurisdiction within our region, within our counties, have stepped up and offered support in what we're doing. We've reached out to surrounding districts for drivers. We have the ability to have the buses, but drivers are the issue. Request state assets through the state, through the STAR request. Again, we realize that everybody's in the same situation that we are, not only the state of Texas, but around the country. Use private transportation companies to assist in evacuations. We've reached out to different agencies for standby and to see if we're able to use them. We will have access to ambulance, which will be used. If we need assistance with ambulances, we'll use ambulances. So all these have been on the table and all these have been discussed. So we'll continue to work on the issues up until the time of the evacuation. This is an ongoing process, and with the help of everybody on the team, we're doing a great job doing that. Next, please. Due to COVID-19, the evacuation team had to put together a plan to make sure that safety precautions were in place, not only for evacuees, but for the staff at the evacuation hub. Working together, the team developed a plan taking into consideration the following: face coverings. How will we tackle that issue? We've worked with our health department. We've got face coverings for everybody that's going to be coming to our hub, working with our RTA, which is our local transportation, which will be bringing the people to the hub, working with them where they will supply face coverings to the citizens of Corpus Christi. We will work with our health department on, as the people exit the bus, temperature check. We will work on social distancing, which our staff has already purchased and received the sidewalk mats, or we'll make sure that the staff will keep everybody that's evacuating social distance. We will have 3 registration areas instead of 3 separate ones. Instead of 2 at each table, we'll have 1 person registering at each table. Again, separating the tables, social distancing, which is very important to us. Proper signage is also very important. Working with the team, we developed signs that we will be flip charts, letting people know because of the face covering. We realize that they won't be able to see our mouths, or we won't be able not be able to talk properly and loud enough. So we'll have proper signage where they can flip chart, time to register, time to get on the bus. Interpreters are very, very important, and sign language person is very, very important. We realize that these are challenges, but the team is up to the task, and we'll continue to work on this as we move forward. Next, please. Resources that we use locally and within our region to contact information for the public. We use our news media, radio and TV, KLUX radio. KLUX radio is specific whenever we go into an emergency situation, they will suspend all their music and they'll work directly with the EMCs within our area on giving out information to the public. For the city of Corpus Christi, they can go to cctexas.com, click on Ready CC for information. Social media is very, very important. We utilize social media, Ready CC, and for Twitter and Facebook, and reversealert.org. This is our mass notification system that we use to notify the public on the incoming storms, if we're going to evacuate, where we're going to evacuate. We also use this reverse alert for our STEER program. People that register in STEER program, we enter them in the reverse alert system. And so whenever we're going to be evacuating or we need to give an important message out, they are on the list and we will notify them of the evacuation process and which zones that we're going to evacuate. So it's very important that we get that STEER data. We promote STEER. People need to go ahead and register now, and we continue to promote that. Our functional needs support team is very, very important in this process, and we make sure that they are there at the front of the emergency and front at the planning session. Next, please. That concludes my presentation. Again, we realize that COVID-19 is very, very important, and we need to realize that evacuation, sheltering, we realize that's very important with our partners that are going to shelter. So thank you very much, and we will continue to work on this. And if anyone on the line has any questions, you can please reach out to our office at 361-826-1100. Thank you for your time, and God bless, and stay safe.
Thank you, Billy. Certainly appreciate everything your team's doing over there. I know hurricane planning is year-round. It just doesn't start when hurricane season approaches. You and your team have done a phenomenal job putting things together and meeting. At the end of this presentation, we will have a short period for Q&A, so we'll address that then. Next up, John Phillips. Thank you, John, and good morning.
Morning, Gary. I just want to say I put that fish on the slide there just for you.
Nice looking snook.
So evacuations really successfully start now. Just like everything else, preparedness is key in a successful evacuation. For a facility, whether it's a nursing home, skilled facility, assisted living,
Appears we have a little bit of technical difficulty. John, you're freezing up. I don't know if you can hear me or not. We'll give you a short period of time, come back online, or we'll bump to our next presenter and come back to you. It's all about the bandwidth, folks. With that, Brandon, if you're ready.
Sure.
Can we bump to Brandon? Good morning, sir.
Hey, good morning, everyone. Thank you. No problem. Thank you. Thank you for everyone online that's joined us, taking time out of your day to be a part of this. And I'm probably going to have to tap dance a little bit here to help make up some time for John there. John, we hope to get you back soon. So for those that aren't familiar with local emergency planning committees, you need to make sure that you are very familiar with them because they're very important as a part of the overall emergency planning process. It brings together private industry, which I represent, and all of your elected officials, to include police and fire chiefs, EMS. It's a really awesome platform for everybody to get on the same page. And if you're not participating in your LEPC locally, please reach out to those folks and take this opportunity to join them and be a part, because that's what makes LEPC successful, is a good membership base that is active in the planning process. So from a industry standpoint, I find it very interesting that many of my industry partners have approached COVID much like we would a hurricane, or probably post-hurricane situation where we do some different things with different shifts to try to spread those groups of people out a little further from what they normally are. And from a hurricane standpoint, that really is because you've got fewer people available as they start coming back into the area. Some of them are displaced, as we saw in Harvey, and you have to provide them transportation and or living accommodations. So we haven't seen that as much with COVID. However, we have to some extent where we've had family members who become positive, and we try to place those folks within separate living area to try to keep them separated. So we've seen a lot of similarities between our COVID response and how we would respond to a hurricane. I can tell you firsthand that having the face-to-face interaction with folks as a private industry person, having that face-to-face interaction between your elected officials and your emergency managers through LEPC was, bar none, one of the most valuable things that came out of my participation in the LEPC. Being able to understand who to call and understand what they're doing is extremely valuable. Things that will change for us from a COVID standpoint when it comes to hurricane evacuation is understanding that hotel space may be already limited in other areas due to COVID. So we've talked about that. We've talked about the need to reserve or secure those hotel rooms early on versus closer to evacuation time. We've talked about the potential of what those positive cases might look like when we do start the evacuation process for employees. And you know, generally speaking, from an industry standpoint, you don't put them on a bus. You typically, they travel in privately owned vehicles. So less of a logistics issue for private industry, I think. But nonetheless, generally speaking, industrial companies typically try to help their employees out as much as possible when it comes to placing their employees somewhere if needed, if they don't have a place to go. So the other part of that is returning, making sure that, you know, as a part of a national disaster currently, making sure that we can secure those restroom facilities, shower facilities, places for people to sleep when we're trying to bring up critical infrastructure industry facilities becomes very important. And you have to put a lot of forethought into that, right? You have to start, as we've mentioned a couple of times on this conference already, you have to start that now. You have to start thinking through those possibilities now because the nation is strained for resources in a lot of places. And a hurricane certainly would just add to that. So other aspects that I think that we've really started to talk through have been internally when industrial folks decide to ride out a hurricane and the considerations that COVID bring into play from that aspect, because generally when you have a ride out crew, it's fairly tight quarters. Folks are fed via buffet style, and you can't really do that during a COVID era that we're in. So that's really changed the way we've had to look at some of those items. Other aspects that we've had to look at, I mean, down to shower facilities and cleaning crews, where you might normally have a cleaning crew that rides out the storm. You probably won't in this era because of the COVID risk. So there's just a lot of extra things to think about and talk through and consider during this time of national disaster. So from an evacuation standpoint, we have discussed other options such as man camps or remote places for folks to stay, such as RV and camper spots. That's a little more difficult logistically, but certainly a consideration that needs to be looked at. Forgive me, sorry. So with that, please take this opportunity to join your local emergency planning committee. Make sure that you get involved with them. Again, excellent resource. Many of the folks on this panel I've met through and developed relationships through LEPC. And it's really important that we all get involved in that aspect. Take the time now and start planning through, for my industry partners in this conference, take the time now and start planning through additional considerations, such as Mr. Delgado mentioned, when it comes to COVID and not being able to see people speak, because that makes a big difference. It was an eye-opener for me, and I thank you, Billy, for bringing that to light. The flip charts are an excellent idea. Again, I don't have anything else, and with that, Gary, I'll turn it over to the next presenter, or if did we get our previous back?
It's all good. I think John's back online. I appreciate your input, sir. Like I said, we run a little bit short. It just gives us more time for to open up a question and answering at the end and get some discussion going that we may not cover on topics.
Absolutely.
So, fantastic. All right, John, you back online, sir?
Back online. So like I was saying, having secondary means of taking care of things.
Copy that. It's all yours, sir.
Quite prepared. Didn't have the second internet up, but we're back up and here we are.
Great. Good to have you back.
All right, so I'm going to start back. We didn't get very far into it. So like I said, successful planning on an evacuation honestly starts now. You need to have an idea of if you had to evacuate your facility, regardless of what type of facility it is, how that flow is going to work for your particular facility, where your patients are going to go. You need to have multiple receiving facilities in different regions of the state. You also have to have multiple agreements with transportation agencies, different transportation agencies, to get those patients to that receiving facility. If you have both of those in place, the next thing you really need to do is you need to have a trigger point that's already decided, either at your local facility or if you have a parent company, at the parent company. Decide how many hours out for a hurricane or another known event are you going to start evacuating your facility. I would suggest that you make that decision early. You discharge what patients you can early and often, and try to reduce the number of patients that you're moving. The logistics of moving people is not the easiest task. We take up a lot of room, and there's a lot of things that go along with moving people. Have that decision point. It needs to be a line in the sand for your organization, and when you hit that point, you need to enact your plan. One of the things that takes the longest when you're evacuating a facility is having the correct patient information already ready. In previous events, strike teams or ambulances or even private companies have spent quite a bit of time waiting at a facility to get the patient's medical information so that they could leave to go to the receiving facility. Have that face sheet, that one pager that gives the overview of that patient ready early on, so that we can, when the ambulances or your transport company arrives, you can load your patients in a way that they can go. If you do need to make a request through the city, county, or the state for an evacuation of your facility, you're going to make that request through your emergency management coordinator. Texas Emergency Medical Task Force under the Department of State Health Services and at the direction of the Texas Division of Emergency Management has ambulance strike teams and ambuses for the evacuation of facilities. An ambulance strike team generally is 5 ambulances with a strike team leader. And then what we call heavy strike teams would be 2 ambulance strike teams with an ambus. Ambuses are capable of moving 18 to 22 patients. And then ambulance strike teams, given the type of patients, could move up to a maximum of 10 patients. When you request evacuation of your facility, you need to have a couple basic information ready. We need to have an accurate count of the number of people that you need to evacuate. Ideally, we need to have a destination facility for those patients. We need to have an accurate number of patients by type. We need to know how many acute medical patients you have that are going to require one-to-one care for a provider to the patient. We need to know how many low acuity patients you have that are fairly stable and can have a higher patient to provider ratio. And then we also need to know if there's any extenuating circumstances. As in today, do you have infectious patients that are going to require a different level of care? That basic information allows us to provide the right type of package in a timely fashion and get your patients to safety quicker. If you would go to the next slide. I'll give a little overview of Emergency Medical Task Force. Evacuations is one part of the things that we do. Another is, and some of you may have seen this, so you'll see a strike team of ambulances in the left corner and then multiple ambuses outside of a mobile medical unit. Mobile hospitals are something that you'll typically see after, let's say, a hurricane or a major storm flood type event. So after the evacuation is completed, for anybody that remained in the area and if critical infrastructure is damaged, we can bring in mobile medical units, which is basically a field clinic. It's not a full-blown hospital, but we can stabilize and maintain patients for up to 72 hours or so, depending on the acuity. If you would go to the next slide. These are some of the different missions the EMTF accomplishes, and that list is growing every day. The ambulance strike teams, the ambuses, are going to be the ones you see most commonly in evacuation. The mobile medical units, nurse strike teams, typically you will see after an evacuation, after an event, if there's been infrastructure damage or staffing issues after an event. Air medical services also do play into the evacuation portion, depending on, like I said, the location and the weather of the event. Infectious disease response unit. At this point, I think almost all of us fall into that category now. Infectious disease used to be something that a few people did, and every once in a while, it wasn't something that a lot of us spent a lot of time on, and a lot of us didn't have really great, robust plans on. Nowadays, most of us have a pretty good idea of how to take care of that, and all of us have at least a decent level of training in it. Mass fatality operations. Unfortunately, this is something that has to be planned for, has to be trained on, and we do have that mission task set for large scale events if that becomes an issue. Next slide, please. So I said earlier, if you do need assistance from the medical task force, you'll need to request that through your emergency management coordinator. If you're at the local city level, you get with your city EMC. It may be the fire chief, police chief, or your city may have an emergency management coordinator. That coordinator is going to work with the county emergency management coordinator to see if the resources you require are within your local jurisdiction or within your neighboring mutual aid departments. If the county is unable to provide that need, then they're going to request that from the state. So in this case, it would be Gary at the DDC level. And Gary's going to work within the region, the multiple counties, to try to fill that request, try to help with the evacuation or the dewatering pumps or whatever that equipment might be. If we're unable to fill that in the region, then we're going to reach out to the greater part of the state to try to fill that request. And the same works for when you're requesting EMTF assets. Next slide, please. So there's my contact information. 10 minutes is a short amount of time to try to discuss all the intricacies involved in evacuating a facility. But just to recap it, start planning your evacuation now. Start having an idea of where your patients are going to go and how you're going to get them there. The state's more than happy to assist with that, but we can't be the only plan, and we shouldn't be the only plan. You need to have that. You need to have multiple working plans for your facility, and if those don't work out, then reach out for state assets, and we'll do what we can to assist you. Thanks, Gary.
Thank you, John. Fantastic. I think you said a lot when you said the time is planned is now. It's yesterday. We need to keep planning and moving forward. Spot on. Thank you for your presentation, John. Up next, we've got Captain McQuaig. I have the pleasure and honor of working with this man every day. He brings a lot to the plate, and we're very fortunate to have him in our district here and in the state of Texas. So good morning, Captain, and thanks for joining us.
Good morning, Gary. Thank you for inviting me to this. I think you're giving me way too much credit. I think you're a phenomenal guy to work with, and as we found through these COVID times, that the entire Coastal Bend region has really done a phenomenal job of coming together and working together as a team. And I think it's because of all the planning and preparedness that we do in all types of events and encounters. And as John was saying, the time to plan is now. And I think that we have been planning, and that has come to fruition when things come up and we're able to tackle them and move forward and just everything runs seamlessly. And it's really a beautiful thing to be a part of, is watching so many different agencies and groups and team members just come together and work so fluidly. I do want to talk about the Evacuation Authority. You can go to the next slide. Of course, when these emergency situations come up, a lot of it comes from the decision-making comes from the county judges and mayors. They have the ultimate authority to determine when there's going to be evacuations from citizens within their own area of responsibilities. Then it becomes my job to basically make sure that all that's coordinated when we are. Some of the strategies that we use to control traffic is the implementation of a hurricane evacuation lane, and then also contraflow. The hurricane evacuation lane, that's the lane when you see driving to San Antonio on the right-hand side, and it's got the little hurricane symbol on there, and basically it makes it 3 lanes of traffic for everybody to go north. The contraflow, we shut down the southbound side of the interstate with patrol cars, EMS, TxDOT signs, whatever we could get available, and so that there's nobody coming the wrong way on the one-way road, and we have the 4 lanes going all northbound, and then that evacuation lane, the hurricane evacuation lane, becomes one for first responders. As we saw several years ago in Houston, there was a need for gas trucks because people were running out of gas and when they were stuck. And so these lanes are all run by a collaborative effort of state, local, and federal law enforcement agencies. We can go to the next slide. Again, the decisions made by the county judge or the mayor, they determine, what their needs are for their area of responsibility, and also the timing of it all. They need to make sure that they're letting everybody know within an ample amount of time that they need to evacuate, and then they notify, the DDC chairperson, and then we start to make that happen. Next slide, please. Talking about the traffic control again, that's the highway patrol. We get together with the local agencies, and we have them. We've already planned this. We know where we're going to need extra assistance, which roadways are going to need to be covered and by whom. Some areas are just covered by signage, and we have those. We have those mechanisms already in place. We have the maps drawn out, and we meet routinely with the Texas Department of Transportation just to go over, because sometimes roadways change, highways change, and sometimes those maps change. Not very often, but they do happen. And so, we need to make those changes as they come up. Also coordinate with the TDM, with Barney and his staff, and make sure that that is handled, with other agencies. We can go to the next slide. Again, I'm responsible for coordinating the flow of the traffic on all the roadways, and it depends on how much traffic is out there. And the traffic counts are done by the Texas Department of Transportation, and they just let us know exactly how many people are evacuating. And again, that's very depending. I think during Harvey, there were a lot of people who made the decision that they were going to wait it out, and just my empirical talking to folks out there that stayed, that they're never going to do that again. So my expectation would be, if a storm were to come, within the near future, that there's going to be a lot more people evacuating than there were last time. So I'd expect that traffic count to increase. The other thing is that impacts it is sometimes these storms change their mind, and it may be initially predicted to go towards the valley, which has a huge population. If the decision down there is made to evacuate, because this has to be done, well in advance, if they start evacuating, that's going to put traffic on the roadways. And then if that storm makes a turn to come up towards our area in the Corpus Christi area, then obviously that's going to increase the traffic, and that's going to make the determination on how many lanes do we open up and how do we do those things. If we can go to the next slide, please. And again, this just involves a lot of coordination between the local governments, and it's really important that we all work together and we have this relationship, because if one part of the agency can't fulfill their requirement, there may be a section of roadway that isn't protected, and that could cause problems by somebody going the wrong way on a one-way road or going into an area where they really shouldn't be. We can go to the next slide, please. It all starts off with the local government determining the needs to evacuate. They notify the DDC, and we activate the traffic management plan, and we reach out to state, local, and federal partners. The CBP agents in this area have been very good at working with us on other traffic issues. Anything from minor crashes to major crashes in other areas where we have to shut down, roadways, overturn truck tractors, just anything of the nature. These assisting partners are always in place for the minor things, and we practice the major things. And so there's not a concern there whatsoever. If we go on to the next slide, please. Again, here's just some of the entities out there that we could rely upon. We talked about the DDC and local agencies. Parks and Wildlife is another state asset that is out there that could provide any extra assistance that would be needed, to render aid or shut down a roadway or anything in between. We have our DPS helicopters out there, and our fixed wing aircraft. We have a high altitude Pilatus that can fly high and scan for miles on end and let us know what's going on. They also have the capabilities where they can, whatever they're viewing, they can send it back to a command post, and the folks at the command post can see what's going on. If we could go to the next slide, please. Again, I just want to, close off with, everything is based on the needs of what the local agencies have. They make the county judges and mayors make the determination, and they tell us what they're needed. A lot of our operational capabilities have been pre-planned, and so we have a very good idea of what is needed, and it's constantly evaluated. One thing I'd like to add is that, what happens is the agency's initial expenditure of money to emergency is basically regularly appropriated by the legislature. And if
You froze up right at the end, Captain. We'll give him a minute to come back online. One of the challenges we see with COVID today, of course, is the technical challenges in the infrastructure it takes just to support meetings like this. And it appears it's going to be the way of the future right now, for a short time being anyway. With that, I want to say thank you to the captain. Greatly appreciate you being online, sir. I'll get all the panelists to come back online. We'll go into a Q&A session. One of the things I want to stress, and I can't stress it enough, is the reliance that we have on our partners in the National Weather Service. When it comes to evacuation, it is extremely dependent on what direction we're given from them as far as the size of the storm, intensity of the storm, and where it's going. That has a profound effect on what's going on. One of the things that is extremely important is listening to the local officials. I know we have a whole gamut of folks on here, probably from citizens to management, emergency management experts, of course, and the anticipation and the planning that goes into it on the basis of being a dad and a grandfather and an average citizen. One of the things you want to do is plan and put that plan in writing. Look at it as if you don't have a plan in writing, it's a dream. So we need to make that plan. And we need to have alternate plans too. You need to have that evacuation packet together. And I would encourage you to go to the Weather Service website and look through theirs. Also, the Texas Division of Emergency Management, www.tdm.texas.gov. Also on the STEER committee in the STEER information 211. But we'll go into an open question format right now. And I've got several questions coming in. And we'll do the first one for Billy Delgado. You on, Billy?
Yes, sir.
All right. It says, how did your team meet? What do you do to drill and train for upcoming hurricane seasons in relation to evacuation?
We, again, as we stated in the, because of COVID-19, the usual meetings that would take place in our office or in their offices are not able to do that this year. So what we did, we went totally virtual on all our meetings. We started off with a small group and worked with our bigger groups. And so that's how I got our planning meeting going. For our training, again, we worked with Jeff Newbolt and his team on seeing if they could do ETN training virtually, which we were able to do successfully. We had over 35 people on the line for his training. We are going to do a virtual tabletop exercise tomorrow, working with the COG, RJ, National Weather Service is going to be involved, TDM. We are going to try to pull off, I guess, the first virtual tabletop, working strictly on the evacuation process and how we're going to tackle issues. RJ and the team had a virtual meeting on the injects. So we will be looking forward to that. We really are looking forward to that tabletop. We had FNST training yesterday for, I believe we had 78 people on the line. They ran through, the FNS team ran through all different scenarios. There are different agencies that are going to be involved, training staff, how to communicate, what to watch for, and whenever people are evacuating. So those are just ways that we're doing it, and everything's virtual as everybody else is probably doing. And we're very pleased with the outcome as far as the training, the exercise, tabletop exercise plan, and the planning meetings, as well as the FNST training session and the ETN training session.
Fantastic. Thank you, Billy. Got a question for John. What is the biggest need you have to sustain the mission of EMTF 11?
Partnerships. EMTF 11 only employs 9 people in the state of Texas, and that's the regional coordinators and the state coordinating office. All the ambulances that we use, ambuses, the personnel that show up to operate the MMUs, to set them up, the clinicians, all of those staff work for somebody else. They work for local hospitals, local EMS agencies, fire departments. Without the partnership of our local resources, there wouldn't be EMTF. So the continued support of our locals is by far the most valuable thing to EMTF and the continued operation of EMTF. You know, most of the people in this that are on this webinar probably play into that operation or play into that support level in some form or fashion. Even if they're not a public safety agency, if it's a local emergency planning committee or you know, a county judge's office or emergency management coordination, knowing your local regional coordinator, knowing the assets that EMTF can bring to your region and how those play into different reasons. It's not just hurricane evacuations. It's, I mean, right now, COVID response. We have 5 strike teams working in the lower Rio Grande Valley, helping to bolster the 911 system there that's overwhelmed currently with calls. It's knowing how it plays into a flood event, into an earthquake or a tornado event. Just understand the resources that are available to your local community and when to enact those, and then more importantly, how to enact those. Know that ahead of time, because when an event's going on, and we all know this, we've been through this before, when you've got 15 people crowded into a room made for 5 that's trying to run as an emergency operations center, it's hard to figure out who to call at that particular time. Build those relationships ahead of time, know who you're talking to so that it's a more familiar conversation and both people on the line know what the local resources are and how best to assist that area.
Thanks, John. I think you're exactly spot on with that, knowing your partners, their capabilities, knowing your neighbors, and what's going to come in the COVID challenged response. Right now, I don't want to paint a rosy picture. I mean, every community in the state of Texas, every county in the state of Texas, every city in the state of Texas, and every nation in the state is facing the same challenges with the COVID. All the emergency managers, and medical facilities throughout the country are being taxed right now. And that's one of the reasons we're looking at ideas just like this to get together, come together and know our cooperators and see what our capabilities are on the local, regional, and state levels, as well as federal. So thank you, John. Next question for Brandon. How can the private sector coordinate with local officials during a crisis?
How can the private sector coordinate with local officials during a crisis? Again, I think it starts with the central theme of this entire panel, and that is partnerships. I don't think that one of us didn't mention the value and importance of those stakeholder partnerships, whether it's locally or regionally, and participation with all of those different groups, whether it be any of the various public meetings, to include LEPC meetings, but there are other platforms that are available. But again, it really starts with developing those relationships, those stakeholder relationships, both on the public side and the private side, that make all the difference in the world. John alluded to it just a few minutes ago. Understanding what your local resources are, understanding who to call and when to call them, and quite honestly, understanding that they're busy when you don't get an immediate answer or an immediate call back, because they're dealing with a lot of the same things that you're dealing with, because you've worked with them, you've drilled with them, you've done exercises with them, you understand their personality. Again, that all plays an important role in when it comes to the actual emergency or the actual evacuation for a hurricane, as we're talking about today. Makes all the difference in the world.
Thank you, Brandon. And spot on again, that knowing what to do prior to and that coordination and cooperation. Captain McQuaid, the next question's for you. How likely is it we will actually deploy contraflow during the evacuation of the area?
You know, as a response to how likely, it really depends on the need and what the traffic patterns are. They're going to dictate what we do. If we need to do it, it's there and it's ready to be set up. You know, again, we have the partnerships. I'm going to use that word again, and we work together with our local agencies, and we go through and we practice it. We don't actually, you know, send officers out there and set up those things and actually set up there, but we do drive the route and make sure that the roads need to be shut down are still identified and covered. And so we're ready to do that. And so, you know, we're really just going to let the need dictate what we do as far as that response. And again, that comes from, you know, mayors and judges. If they're shutting down, we're probably going to be standing up. And you know, we have the hurricane evacuation lane first, And again, the volume of traffic is going to dictate that. But we're ready to go and ready to do it if we're needing to. And that's not going to be an issue whatsoever.
Copy that. Thank you, sir. It is a very dynamic process. And I don't know if most people realize it, but one of the things in the coastal bend and the other areas of the state that are challenged along the coast with hurricane issues is meeting on a regular basis with our TxDOT partners and going over that traffic management plan and looking at those intersections that are and verifying everything's still valid, exactly like you said. Thank you, Captain. I'll go through some of the, let's see, come from Ronald Williams. I have a concern with PPE for evacuees. Who will be responsible to furnish the masks necessary for individuals that might need transportation during this evacuation? Will it be the local sending? Will it be the local sending authority? You want to take that one, Billy?
Sure. It's a great question, and one of the first questions that came up in our initial planning meeting. We will be supplying masks for any evacuee that would like to evacuate at the evacuation hub. Working with in discussion with our regional transit authority, they will also provide masks or face coverings for any evacuees that would like to evacuate. So the city, Corpus Christi, will be making sure that everybody that enters the building will have a face covering.
Thank you, Billy. And I know one of the things that TDM has done is currently looking at strategically placing some PPE in certain locations just to deal with that situation. Thank you, Billy.
Yes, sir.
Next question is, what happens if the place that a county normally evacuates to decides that those evacuees cannot come to their community due to COVID concerns? I know Billy can probably chime in. I know I can. That's something we're currently looking at. That's extremely concerning on what we can do. And, you know, looking at the alternatives to that. If you've got plans with other counties that are going to take your evacuees, is that still valid? Are they going to accept them? If they're not, that certainly is something that sending community or that sending county needs to validate and look at alternate routes. You know, can you leapfrog? Can you go to an area that you wouldn't normally go to and hold there and come back? One of the dynamics that really comes into play on that, and I'll come back to our partners in the National Weather Service, is exactly what is that storm doing? You know, we usually evacuate to the north or away from the coast. With COVID, it may be a situation where we have to go along the coast to seek that shelter. You know, can we shelter in place? I think with there's going to be some very hard decisions based on sheltering in place. You know, we talk a lot about it, hiding from the wind and running from the rain. So a lot's really going to depend on what that storm is doing. This is from Janice Shue. I know there's been some questions on some steer stuff. Of course, it's steer, like a wheel, not like a cow, or like a calf. State of Texas Emergency Assistance Registry. It's found on the TDM website. You can search for STEER, S-T-E-A-R. The STEER program is a free registry that provides local emergency planners and emergency responders with additional information on the needs in their community. Thank you for typing that out for me, Jana.
Gary, I want to jump in on the steer patients.
You
I
bet.
didn't mention it in my presentation, but evacuation of steer patients is complicated, and it's problematic. Sometimes it's hard to maintain a valid and current steer registry. You know, the types of folks that need to be on that list will go in and out of facilities, whether it's rehab or they may end up in an assisted living facility versus being at home where originally they were on that list. I know all of us have more things to do than generally time to do it, but it really is important for local emergency management coordinators and county coordinators to keep those lists as accurate as possible. I know during Harvey, we had multiple people that called that weren't on a steer list and should have been. that when, home health was under mandatory evacuation, everybody left and these folks were left at home alone and needed help in evacuation. And while we're able to get to those people and get them evacuated, knowing ahead of time and having a good plan is always much easier than a last minute effort to make that happen.
Well stated, John, and thank you. And with that, we come to the end of this evacuation portion. I want to remind everybody there will be a question and answer fact that'll be put out. I know there's questions on recording, and if the recording will be available, and we'll answer those questions at the end of today's presentation. With that, we'll go to a short break. We'll return at the top of the hour at 10 o'clock. During our break, please enjoy these short videos from our generous sponsors, HEB Engineer. Can't say enough about those folks and our cooperating partners at HEB Engineer. And with that, cue video, and thank you.
Guys.
130-mile-per-hour winds, a Category 4 hurricane, Harvey, hitting the Texas coast.
It is raining like you wouldn't believe. The winds are incredible.
Oh my God.
Harvey's persistent remnants meander toward Houston.
This is the command center where HEB has brought together all of its experts who are supporting everyone from our stores to our warehousing to our manufacturing plants as a result of Hurricane Harvey.
During the notice that a hurricane was coming, we were selling about an 18-wheeler of water every 90 minutes. We were actually partners and customers were helping us get them unloaded and sold.
That's part of what we're trying to do is manage two catastrophic disasters. Right. One of them in Corpus Christi, now the rain event in Houston. So
maybe the largest storm in our lifetime here in Texas.
Absolutely, absolutely largest flood event in Texas history.
What's going on over here off Rittiman Road is that HEB is getting ready to launch an aid effort in a big way.
We just pulled into Rockport a few minutes ago and got our truck situated, and this is really, as we were driving in, the first time we saw just the visual devastation from Hurricane Harvey. And I know it personally breaks my heart. The Texas coast holds a really special place in the hearts of all Texans.
You know, with the hurricane hitting Harvey and the rains here in Houston, last Tuesday the water started to come up. About 1 o'clock, decided to shut the store down. We started to see about 2 foot of water in the parking lot. At that point, I made the decision to get partners home, customers home safe. So within an hour, we were taking on water. And we continued to take on water until the ultimate outcome was about 6.5 feet inside the store. I asked for Kingwood because I wanted to be here. And it's been my baby. I've been excited about it from day one. Put forth an enormous amount of time into the store. And it's a little devastating, to be honest. But we'll come back. I know we will. So it's just going to take a little bit of time. But walking in, seeing it every day, yeah, it's pretty tough. No doubt.
Family helping family. That to me transcends anything that we have ever talked about at HEB. If you think about it in your own personal family, when your family needs help, you drop everything and you go, right? That's what's happening today all throughout HEB. Because when you give up your time, you're giving up yourself. And that's what every single one of you is doing. So thank you from the bottom of my heart, because without you, one, we wouldn't be back in business, and two, there would not be such a thing called the spirit of HEB. So go forth, God bless and safe travels, and know that the entire company is behind you, and you are representing the spirit of HEB with what you do.
So HEB brought its mobile relief units from San Antonio that it's taken to other serious weather events. A much needed pharmacy, a business center for payments, cashing checks, and 2 mobile kitchens. They're equipped to prepare and give away up to 2,000 meals 3 times a day to residents and first responders.
And really just want to do our part to support not only our first responders, but also the individuals who've been displaced that have shown incredible resilience and spirit. They're Houston strong and we're Texas strong.
To Mr. Charles Butt and everybody at HEB, a donation of $5 million is truly incredible. I mean, it is, there are no words to describe when people step to the plate like that.
I do want to applaud HEB here in the state of Texas.
This is part of the reason why HEB is so great. Doing this for our partners, taking care of our own as well as the community is something that's truly awesome.
When disaster darkens Texas skies, the spirit of HEB shines brightest. Thank you, partners.
When we first got here, we had two things, an empty field and an idea. The field was muddy. Heck, some people thought the idea was too. There was one thing we knew for sure. You don't build the first from-scratch LNG export facility in the United States with just a field and a dream. You need commitment, customers, teamwork, support, community. Early on, we had believers. It started with our customers. They saw the potential we saw, the cleaner energy we could provide. Our leaders in Washington, Austin, and throughout the Coastal Bend did too. They recognized the energy revolution here in America that could deliver cleaner energy to the world, and that the Coastal Bend could be a gateway to that growing future. Everything about this place is massive. Each storage tank can fit a Boeing 767. There's about 66,000 tons of structural steel, 310 miles of pipe, 327,000 cubic yards of concrete, and 2,500 miles of electrical cable. Well, that's enough to cover the distance between California and North Carolina. There's nearly enough steel to build 7 Eiffel Towers, and the amount of concrete here alone could build more than 39,000 swimming pools. And the ships? Well, they're almost 1,000 feet long. What has this place meant for the Coastal Bend? In all, we've invested over $15 billion, and we've created jobs. Lots of them. Our construction workforce exceeded 4,000 at its peak, and this place will employ hundreds of Cheniere employees and contractors for decades. And from the looks of things, we're not done growing here either. Now, you don't live in the Coastal Bend and not fall in love with this place. The community, the spirit, the natural beauty. Cheniere can't ever repay the support we've been given here in the Coastal Bend, but we're going to keep trying as long as we're here. We know that building something this big doesn't come without disruption. More traffic, more activity. We live here too, so we get it. But we really appreciate the support and patience we've been given, especially by those who live close by. That's been the biggest realization about this LNG facility, that the facility isn't the most important thing we've built here. It's the lives and families and homes we've built here in the Coastal Bend. We knew the dream was big, but we knew the dedication there was too. We've built this place on time, on budget, and we've done it safely. And it's now more than an LNG plant. It's a connection between the United States and the entire world. What we've done here will deliver cleaner energy around the world.
I'm proud to be a part of this project, part of Team Cheniere and everyone who's supported us. And I'm excited to see what's next.
Hello and welcome back to the 2020 Coastal Bend Hurricane Conference, A Pandemic Approach. We're pleased to see all of you joining us here today for this important discussion, and personally I'm honored to be part of this conference as well. Our second panel today will focus on mass care and sheltering. With the many unique aspects of our response and immediate recovery, there's no way we'll be able to get to come close to covering all areas of concern. However, our focus today will be to take a glimpse into some of the most pressing areas due to COVID-19. Joining us today are 4 subject matter experts on the front line to address mass care and shelter-related concerns. Our 4 panelists will speak, and after they speak, we'll have an opportunity for Q&A. Our first panelist will be Chief Patrick Cepeda. He's the Emergency Manager for the City of San Antonio, a role he assumed in 2017. This August, he is approaching his 37th year as a professional firefighter. He was also deployed to Staten Island during Hurricane Sandy and served as the branch director of Staten Island for 21 days to support recovery efforts. Next, we'll have Robert De Leon. He's the Region Support Manager, American Electric Power, AEP, with more than 30 years of service with AEP Texas. He is currently responsible for resource planning in regards to the electrical distribution system and forestry programs. Responsibilities include emergency planning and preparedness, and serve on AEP Texas Incident Management Team as the Logistics Section Chief. In 2018, he was part of an AEP incident management team that deployed to Puerto Rico to assist in its restoration efforts after Hurricane Maria. And Dr. Mitchell Morber, Medical Director for numerous public safety agencies in West Texas. He serves as the Texas Disaster Medical System Steering Committee and served on the Mass Fatality Management and High Consequence Infectious Disease subcommittees. He is consultant to the Emergency Medical Task Force Medical Directors Committee. He is a past member of the Disaster Preparedness and Response Committee and the Medical Directors Committee of the Texas Governor's EMS and Trauma Advisory Council. He is founder and chairman of the Catastrophic Guidelines and Triage, and is chairman of the Taylor County, Texas Local Emergency Planning Committee. In 2019, he received the Journey of Excellence Award for outstanding dedication to the Texas Emergency Healthcare System. And finally, Mario Chapa. He's the State Mass Care Coordinator for the Texas Division of Emergency Management. He has extensive experience in planning, development, implementation, analysis, and documentation of preparedness projects. Mario previously worked for the American Red Cross as an emergency services specialist, where he partnered with local government and personnel to provide shelter to citizens. So again, a reminder to feel free to submit questions throughout the presentation. Use the Q&A button down on the bottom of your screen, and any questions that we're not able to get to will be answered and made available in a recap document. We will take a few questions after the entire panel speaks this morning. And Chief Cepeda, we'll turn it over to you.
Good morning. My name is Patrick Cepeda. I'm the Emergency Manager for the City of San Antonio. I want to talk to you today about disaster sheltering for both the general population and first responders. Slide. I'll pass through this one, but a little bit of bragging. So this is our Emergency Operations Center that we built after Katrina and Rita. It serves both the City of San Antonio and helps us support the state during hurricane operations. Slide. One of the strengths of our EOC is our RMOC. Our Regional Medical Operations Center is here in our EOC, and during Hurricane Harvey, we coordinated 2,000 hospital transports downstream. Slide. So about preparedness, preparing for that hurricane season, preparing for that sheltering need. A big part of it is your emergency operation plan, and every city has an EOP, and exercise and training that cannot be stressed enough, and will be stressed again during this presentation. Slide. So your EOP, your emergency operation plan, is like your football playbook. It kind of dictates how your city looks at emergency responses and actually assigns responsibilities and tasks to each department. Everything from warning to actually sheltering, mass care, and recovery is covered in your EOP that should be part of your sheltering plan as well. Slide. So during Hurricane Harvey, it was a different storm. We set up a base camp and a logistics support area. We had 7,000 first responders in our base camp waiting to go downstream to assist and rescue. In our logistics support area, I think we had 688 coach buses, 347 ambulances, and 269 18-wheelers full of commodity ready to go downstream, as well as 3 mobile hospitals. Slide. So hurricane planning, as discussed, San Antonio has always been the hub for hurricane response because we're far enough away from the coast that those hurricane winds don't affect the city of San Antonio. Back at Katrina and Rita, we hosted in shelters 40 to 50,000 people, have been active since then with Dolly, Gustav, Ike, Hurricane Harvey. Slide. So about sheltering, the things you're going to need to do. So you need a shelter plan, you need a facility acquisition, personnel, activation, push packs in your warehouse, a shelter layout, reception, shelter operations, ordering, which you'll do through WebEOC through your 213 or your STAR. You need to plan for FNS, for functional needs. Pet shelters. We'll cover some lessons learned in scenarios. Slide. Slide. So sheltering is year-round. I mean, it goes year-round. Facility acquisition is a big part of it. Having a real estate team that works for me, that works with my shelter managers to find real estate, to find warehouses, training classes, working with your real estate team, right? And so we find a piece of real estate that we like, we send everyone to it to evaluate it. That's your ADA for accessibility, your fire department, fire prevention for inspection, public health, your power, ours is CPS, your water, your human services. Anybody who's part of your plan should be on that survey team to go take a look at that building before you acquired it. Slide. An example of a mega shelter, and of course, we'd rather do a mega shelter than small shelters, many reasons, but the basic reason is if you start setting up small shelters, you take away the wraparound that you have for a shelter away from other shelters possibly setting up, because you do need shower trailers and bathrooms and other wraparound services that you don't want to duplicate at many small shelters. Slide. To run a shelter, you need your shelter manager, an assistant shelter manager. We use the fire department here in San Antonio because all these individuals are an EMT or a paramedic, and they've already had background searches, of course, right? We do the same with our PD for security purposes, public health, Red Cross, VOAD, public works, public utilities, public transportation, private NGOs. In transportation, you know that everything that they did when they were at home, they'll have to do here medically. So if they were on dialysis back at home and they come to our shelter, we have to have transportation set up to take them to their appointments to dialysis. If they were on cancer treatment, we need to take them to their cancer treatments here in San Antonio. Slide. Just an org chart, your shelter task force leader up at top, the different branches that are under him, law, medical, and shelter support. Slide. The reception area should include security check, right, for wanding and checking bags, for contraband and weapons, registration, information, and a distribution table. Distributions for giving out blankets, comfort kits, towels, etc. Work with representatives from your other agencies to establish all these needs at a shelter. Slide. This is just an example slide of one of our shelter reception areas. And ETN, we use emergency tracking network to keep track of evacuees, their pets, and their possessions. Slide. Just a quick run through. There's a picture of our showers and our bathrooms that we have on site. Slide. So you want to think about setting up sleeping areas consider setting them up for families, single people, elderly, guests with functional needs, and accessibility to all your areas. Slide. A picture of one of our shelters. It's that we had here in San Antonio. Slide. Establish safe zones for children. So have an outdoor play area as well as an indoor play area for children in a safe zone. Also, free Wi-Fi is important at any shelter. Slide. These are the support functions you're going to need at a shelter. So you're going to need definitely for the hard of hearing, phone bank, computers for access to the internet, language translation, and transportation we talked about, making appointments medically or accessibility for taking people to the store to make purchases. Slide. You know, the reception area. So the reception area is going to have a triage, right? To triage people, to register them, and to give them directions to the facility that we're sending them to. Slide. We talked a little about ETN, right, and an emergency tracking network. This is what one of the bands would look like. It would be on their wrist that we would band them with. Slide. We talked about ETN. The importance here is that ETN can be used on iPads or iPhones, but you would need to request this to TDM. You would send a STAR request for them to bring the service and the personnel to help you run the service. Slide. We kind of covered this, but we will have security. We will wand bags for both contrabands and weapons. Slide. Population counts are very important in a shelter. Population counts every day affect the ordering that you do. That's the food or care packages, blankets, pillows. So it's important to get an accurate count every day. Most of the shelters, at least here in San Antonio, we close them down to when they reach 75%. That gives you a chance to have some people who might still trickle in to leave a buffer and to get you started opening your next shelter. Slide. You need to plan for FNS. You need to plan for those functional needs that allow an individual to still be independent. These are mechanisms and plans to ensure that all the functional needs for individuals are met and are available. Slide. So talking about shelter layout and wraparound and COVID. So typically your shelter is going to have a 40 square feet per person. In COVID, you're talking about 100 square feet per person now. So you've actually, if you had a mega shelter that had, 2,000 people, well, now it's cut down to 1,000 people. So now you have two shelters. So you need to think about the wraparound. At one shelter, you had a shower trailer for women, a shower trailer for men, and you had an ADA shower, right? You had bathrooms for men, for women, and ADA bathrooms. Now, you need that wraparound also at another shelter. So you duplicated that now due to social distancing if you do a congregate setting, right? And so you need to think about isolation rooms inside of your shelter. So if someone does show signs or symptoms of COVID, or becomes positive, an isolation area for them. But you also need to think about what other wraparound you need for those positive patients. So you would need bathrooms and showers for possible COVID positive patients. And typically, for some examples, you need one shower for every 50 people. You need one portable sink with 4 heads for every 25 porta potties, and 5% of your total number of your facilities should be functional needs accessible. Slide. So lessons learned, all agencies must be involved in this planning phase. Everybody goes with you to go look at these facilities. Communication is the key. Continual assessment of that plan, and train. Slide. These are some reference materials that I use, and there's a lot on these sites from FEMA about functional support needs for general population shelters. And so also from the state of Texas is a toolkit for functional needs as well. And these were just some references that were used for this presentation. And thank you very much for giving me the opportunity to present today.
Is Robert De Leon on next?
Yes, I can go next. I think the slides are a little off, but I'll go next. So my name is Robert De Leon, and I'm the Region Support Manager for AEP Texas, based here in Corpus Christi. Appreciate the opportunity today representing the private sector, talking about emergency planning and how COVID has impacted our plans. Similar to the public sector, mass care is an issue in our emergency planning, because post-storm, we have to support a number of resources that are here to help. Just to give you an example, during Hurricane Harvey, we had over 5,700 support personnel helping in the restoration effort. And having a good emergency plan is the key to being successful. Our emergency planning has really not changed over the years. In the AEP Texas footprint, where we are responsible for the electrical grid in South Texas and a portion of West Texas, our plans continue to be the same. During Hurricane Dolly, Hurricane Claudette, and Hurricane Harvey, the emergency plans were very similar, especially around the mass care area. So having a good plan is the key. But now with COVID, you have to be able to identify what precautions you have to implement to make sure that your weather event is successful. So in terms of mass care, our plan calls to have these mega base camps, like Chief Cepeda was talking about earlier. Again, during Hurricane Harvey, we had 3 mega base camps in the coastal bend supporting our restoration efforts. And those base camps were open for a minimum of 14 days during that time. So most of the resources that were helping us during Hurricane Harvey came from 10 different states. So as you can imagine, with COVID now, there's a lot of potential to be able to bring the virus into our base camp, so we have to protect against that. Most of our resources that we secure come through mutual agreements that we have in place really across the nation. It includes utilities from Texas, but pretty much all other states. And one of the opportunities that we've had with our mutual agreements is that we're able to plan ahead and modify our emergency plans so that we're prepared. So we have been meeting almost on a monthly basis with other utilities across the country in helping to identify those changes. Some of those changes include sharing data from either the state they'll be coming from, or even their company data around positive COVID cases. When we first started this planning back in March or February, early March, we were very concerned at that particular time with Louisiana, because at that particular time, Louisiana was a hotbed. And so we were working together on how we can share information that was going on. And as we know now, Texas is a hotbed, so we're able to share some of that data with other utility partners. So one of the things that we did to ensure that we can successfully restore power with COVID is set some expectations with our responding utilities around what they needed to bring when they came to help restore. For example, we agreed that the responding utilities would bring with them a set of COVID PPE, like face covering, gloves, disinfectants, and those kind of items, so that the host utility did not have to necessarily have an abundance of those items. They would help in providing those items so that we can share in those supplies. We also created checklists that, as a responding utility, you would do before you deployed to our areas. For example, they agreed to use the CDC self-observation guidelines, where before they deploy, they take a temperature check and they do the questionnaire. And if anybody had symptoms, then they would not be eligible to deploy to help us in our restoration efforts. We also agreed, like I said earlier, mass care is a big issue, and mega base camps was our way to support our personnel. We have agreed to open up more base camps and have less people in our base camps than before. So that's another agreement that we have between our mutual agreement partners. Another important item that we included through this checklist is the teams that are traveling to help us in our emergency event will include a communication lead. It's a one point of contact that AEP will have with those crews coming in, that we can use to either communicate COVID-specific information that they can disseminate to their crews, or information that they need to communicate to us. And that way, the communication challenge is lessened by having those one point of contacts. As an industry, we continue to meet on a monthly basis to share information and refine our processes and learn from historical events. In late March, early April, certain states experienced some storms where these processes were first tested, and we have received very valuable information that has helped us either to modify our plans or include things that were learned into our plans. In addition, as other utilities drill for emergency response, specifically hurricanes, we're able to share information. We're currently working with Florida Power and Light on a storm drill they had 2 weeks ago, where we're going to be sharing information about how the check-in process worked for them with the COVID precautions that were implemented by Florida Power and Light. So we continue to share information as we go along. Some of the major changes that we have done in terms of mass care to our logistical support, we typically set up a gateway, which is a single point of entry for all of our crews that are coming in. And that's where we register them in, and we provide assignments for them to move on to the affected areas. So obviously with COVID, one of the biggest challenge is identifying anybody that might be experiencing symptoms. So we have set up a medical screening process to where as those crews are coming in, we are trying to do a medical examination where we take their temperature using a non-touch thermometer. And then again, asking them the questions based on the CDC guidelines of potential symptoms to identify anybody that might potentially be positive. If somebody is experiencing symptoms or does have a temperature, then we would not allow them to come in and help in their response, and secure other resources to do that to prevent the possibility of exposure. When somebody first comes in and we do a temperature check with a non-touch thermometer, and they experience a slightly high temperature, we'll ask them to wait at least 10 minutes and then recheck them. Just typically after hurricanes, the weather's hot, and so just to make sure that it's not related to the current conditions. And then again, if they experience the symptoms, we will not accept them into helping us with our response. If they pass the medical screening, then we continue on with registration, which we're moving to contactless registration using technology to exchange information. And then we'll also confirm that they have the required COVID-19 PPE and enough supply before they're allowed to enter into our restoration efforts. I mentioned earlier that we use these mega base camps, and we're moving towards smaller base camps where we're trying to segregate companies, where we're not commingling different companies, or segregate from the places that they're traveling from. Like I said earlier, in Hurricane Harvey, we had resources helping us from over 10 different states. So we'll assign either if a group is big enough, one group per base camp. If the group is not big enough, then maybe from the same geographic area that they're coming from. So segregating companies in smaller base camps. We're also staggering shifts where not everybody starts at the same time. There'll be a delay either between 15 to 30 minutes in their shift, so that they can gather the materials that they need without having too many people in the same areas. And that would include also food, how we prepare for food. In terms of transportation, typically what we would do is transport our resources from the mega base camps to their lodging facilities. And I'll talk a little bit more about lodging facilities, but using buses. Most of our resources come with heavy equipment, and so the use of buses is very important to transport. We are now moving to where we're asking crews that are responding to bring a crew truck, where at least instead of using a bus, each individual crew would transport themselves to the lodging location and minimize the use of buses. And that'll cut down on again, the social distancing and those kind of things. In terms of lodging, our strategy has always been to use hotels where available. During Hurricane Harvey, we used a lot of hotels that were up and running at the time, but that's not always going to be enough. So when we do use hotels, we were doing double occupancy. We will now do single occupancy when we can. And if hotels are not available, we always referred back to bunk trailers. So you had a base camp that also had sleeping quarters in those base camps. But because of COVID, instead of trying to use bunk trailers in a base camp, we would prefer to use a gymnasium where we can spread out the sleeping arrangements further than what we could in a bunk trailer. But if gymnasiums are not available, then the use of bunk trailers is our last resort. The industry, though, has moved to smaller bunk trailers. Before, we would use, if you would imagine, something similar to like an 18-wheeler that had about 30 bunks. Since then, in Hurricane Harvey, we use smaller trailers that are they're 20 beds to trailer. It has a divider. There's 12 and 8, and they have their own restroom with shower on each end of the trailer. So we would.
Thank you very much, Robert. We appreciate your presentation. Crystal's had some technical difficulties, and so I'm going to go ahead and introduce Dr. Mitchell. He's going to cover public health issues, sheltering, food safety and hygiene, and medical. He is with the Disaster Preparedness and Response Committee of ACEP. And with that, I'll go ahead and turn it over to Dr. Mitchell.
Thank you. I appreciate the opportunity to talk today. We're going to talk about a few public health considerations. Next slide, please. We know that there has been a catastrophic biological event that is rooted in historical fact, and this occurred in 1918. And we know that should there be a reoccurrence, the practice of medicine will not look like anything like the practice of medicine today. And the societal effects will affect the way we look at government and the way we interact with each other. Next slide. We are in the midst of a major pandemic. We know that the next one may be worse than this one. We don't know when the next one will be. It'll be at a time to be determined in the future. And we know the pandemic flu of 1918 survives in memory more than any other literature. All adults surviving the 1918 pandemic have died. Memory lives in the minds of those who heard the stories, and memory dies with people. And the writers in the 1920s did very little to say about it. But George Santayana in the last century said those who cannot remember the past are condemned to repeat it. Next, please. The lessons that we have forgotten from 1918 and continue on now is that the general population was familiar with various pandemic diseases. And today we have a multitude of new diseases, including SARS, MERS, and COVID-19. There was an early modern transportation system taking days to weeks, and people were sequestered en route. Today we can be anywhere in the world in 36 hours. The sick were massed together in closed environments, and hospitals were filled to capacity. And today we have forgotten about cohorting and isolation. And warehouses and schools were set up as hospitals. And today alternative care sites are not used. Next, please. Public health proclamations to restrain the spread of disease were not heeded. During that time, war bond drives and parades were continued, and today we have demonstrations and protestations. The concept of PPE was not well established, and today we still have difficulty with PPE. Mass gatherings were prohibited, retail businesses were and are affected today, and funerals are with limited visitation. Some towns required signed certificates to enter, and railroads would not accept passengers without them. Today, airlines screen passengers and social distancing is not observed. Next, please. Those incapacitated by illness were so numerous that much of everyday life actually came to a stop, and the effects of the coronavirus lingers for weeks and months. The conditions of 1918 were not far removed from the Black Death of the Middle Ages. It was a medical holocaust. There was no understanding of the viruses, no vaccines or antivirals, and no appropriate PPE. Next. So to prepare, we need to establish a framework to reduce the vulnerability to hazards and cope with disasters, promote safer, less vulnerable communities, and create resilience within the community. Next. As Michael Brown said in 2011, it is the individual's responsibility to be prepared for disasters, and people need to be prepared to take care of themselves. Next, please. So the premise is what happens in your community affects you, and what happens to you affects your community. As Albert Einstein said, the problems that exist in the world today cannot be solved by the level of thinking that created them. Next slide. So we have to begin thinking outside the box. We have to have the intellect to formulate ideas and understand the consequences of these ideas, the ability to make things happen, and the passion to see it through to the end. Next slide, please. It is the me, we, and the they. You have to remember you are your own first responder. After that, you must be able to protect your family and your team, and then you can care for everyone else. Your plan must be available and practice in advance of the event, and you have to have a disaster buddy. Next. Preserving the function of society will receive the greatest priority. Today, we live in a socially fragmented society, geopolitically isolated, ethnically intolerant, with many religious beliefs and fear of government intervention. We have variable educational levels in our communities. Multiple languages are spoken within and outside the family. Family units may be a single parent household or a blended family or a community of the homeless. Next, please. And authorities must maintain public trust and have open, non-distorted, and manipulated communication. Messages and actions must be consistent across jurisdictions, among agencies and organizations to assure a coordinated and effective response. Social media must develop a monitoring strategy to circumvent prejudicial and conflicting stories. And public communication must emphasize personal preparedness to create a sense of self-reliance and prevent infrastructure overload and prevent economic collapse. Next, please. Communications must be pre-planned and need to consider, among others, language barriers, religion and cultural beliefs, educational level, single parent and blended families, ethnicity, homeless and impaired, and have a phased approach to communication. Messages must be consistent with the situation in real time. Next. When considering sequestration in adverse situations, sequester at pre-designated locations. Determine the capabilities to shelter in place versus transport to pre-designated facilities or housing for a designated interval. Preparations include important papers such as mortgage, insurance, etc. Food, water, medications for a designated period. Plan for loss of communications. Communicate with your disaster buddy, and transportation needs for those considered an essential service. Next, please. When sequestering as part of a business plan or evacuation mode for an untoward occurrence, provide for family, elder care, child care, and transportation. Plan for social distancing and use of non-medical countermeasures. Have daily surveillance for infectious disease. Cohort ill or infected persons to designated areas on site, and provide for hygienic needs. Have mechanisms in place to transport sick or ill persons to a higher level of care as appropriate to the situation. And ancillary needs for the duration of the event will include food service, laundry, and commissary, as well as online and distant learning for school-age dependents and needs for privacy, downtime, and rehab. Next, please. We need to have a children's program and encourage vaccination as appropriate, develop programs for unaccompanied children, have a program for pets, companion animals, and service animals. We have to increase security, have ingress and egress control, and protection of comfort areas. We need to maintain a roster of facility providers and support staff and surveil at intervals for infectious disease. And providers must be restricted to work at one facility to reduce the potential for spread of disease. Next, please. Psychological help must be universally available. Each member involved in the response team should be assessed regarding beliefs toward death, terminal illness, refusal or termination of care, toward inability to help the most dependent, attitudes toward drugs, interpersonal relationships with family, significant other, or neighbors, and spiritual needs. For providers and those sheltering, involve the clergy, system directors, and faith-based institutions early. And remember, help for those helping others. Next slide, please. So from 1919 to the present, communities should make plans now for dealing with any recurrences. The most promising way to deal with a possible recurrence is to sum it up in a single word, is preparedness. And now is the time to prepare. From Rupert Blue, Surgeon General, U.S. Public Health Service, 1919. Next, please. And as Benjamin Franklin said, by failing to prepare, you are preparing to fail. Thank you very much for the opportunity to speak with you today.
Thank you very much. I'd like to introduce our next speaker, Mario Chapa. He is the State Mass Care Coordinator for the Texas Division of Emergency Management. Mario?
Good morning, RJ. Again, this is Mario Chapa. I'm the State Mass Care Coordinator for TDEM. Thank you all for inviting me on this conference. Today, I just want to talk a little bit in this brief period about really a couple of things. Next slide, please. Really, three considerations that we're talking about. Sheltering. We've had some very good presenters that talked about sheltering today. So I'm just going to go briefly on that. And then we're going to talk about wraparound services for those sheltering. And then a little bit about the feeding task force. Next slide. All right, so sheltering. I know a lot of you out there have been looking at plans, looking at what's been coming down. I've had conversations with a lot of you regarding sheltering. Sheltering in a pandemic environment is going to be a little bit different. It's not going to be the same. You know, Texas is really good at what we do. We've sheltered for years. We've had some really big events, you know, Harvey. We, as a state, sheltered over 40,000 people in congregate shelters around the state. Spread over around 250 different shelters. So we know, we've practiced, we've trained, we've exercised sheltering as it used to be. In a pandemic environment, it's very different. We've already seen that we cannot put clusters of people together, that we cannot just start putting individuals in 20 square feet or 40 square feet. If you're looking at distance now, you're looking at 110 square feet per person. Of course, that brings down your shelter capacity very much. So we've been working with not only our federal partners, but with our local partners in trying to identify how can we best shelter this year, not only in hurricane, but any other disaster might hit the state. We like to, we've talked to them about non-congregate options, as we've talked about before. That's the use of hotels, the use of dormitories. That's the use of campgrounds if possible. We've talked about best practices on that. We've talked about screening. Chief Cepeda talked about registration coming into their shelters in San Antonio, but we're also going to be adding screening this year. Is someone symptomatic? Are we taking, are we going to be taking temperatures? A lot of you are in facilities now that already do this, and that's just going to be the new normal as we continue going forward. One of the other things we're talking about is isolation and quarantine. Billy Delgado from Corpus Christi was talking about evacuation. We talk about how do we isolate and quarantine individuals who are in the 14-day infectious period if they've been exposed or they've been told by their local health authority to isolate. Congregate shelters need to identify that. The fact of the matter is not every place in Texas is going to have the ability to do non-congregate sheltering, so you're going to rely and go back on the congregate sheltering. So have you looked at those plans and what that means? What is your new capacity? If you had a shelter that could hold 500 people, what does that new shelter look like? What other facilities do you need to look for? And of course, what other things do you need to run it logistically and personnel-wise? If we talk about shelter personnel, who have you identified? The state of Texas, we work a lot with our volunteer organizations active in disaster. There are many BOADs out there that we work well with, not only on the local level, but on the state level. But they are stretched thin just as everyone else is. I know all of you out there have been working this since February, March, and you're thinking a hurricane coming in just, doesn't fall into our plans. But we realize that everyone's stretched thin, so that's why I think it's important that you're working with them today in identifying what you can and cannot do. And then, of course, if you're looking at non-congregate options, have you looked and have you talked with your hotels in your area? Have you talked with areas that have dormitories? Have you talked about campgrounds? If we looked a couple of months ago in the Polk County tornadoes, they use non-congregate sheltering, not only in hotels, but also a campground in which they house families. It was about 110 different family members and 400 people. And it was some of the best practices out there. Next slide. And then, of course, if you're looking at non-congregate, what do the wraparound services mean? If we go for an example of using the hotel as a non-congregate shelter, say you put 250 families in there, that's great. You just can't leave the families in there to kind of fend for themselves. They did not choose to go to this hotel as a choice. So there's going to be, and they are, a disaster has affected them. So the same thing that went to the congregate sheltering, you're going to need to look at what do those wraparound services mean for a hotel, dormitory, or campground. Not only physical, but mental health. Everybody's being affected by this disaster. COVID-19 makes it very uncertain for individuals. You need to look at functional and access needs. The planning does not stop just because we're in a pandemic. Have we identified rooms that are ADA? Have we identified hotels that are ADA? Can people access what they usually accessed before? Transportation, if we're evacuating individuals from the coast on buses, again, we take them to somewhere, say like San Antonio, we put them in non-congregate sheltering. Do individuals just stay in the hotel for an extended period of time, or are we allowing them transportation so that they can live a more productive life while they are being evacuated, that they can work on recovery for themselves? Looking at client casework, it's very different. Best example is American Red Cross. A lot of their client casework is going virtually. They've done that not only here in Texas, but across the nation when there's been different storms or disasters in their area. And then if we're looking at feeding, I'm going to go a little bit over that, but what does feeding look like? Can you make contracts with your non-congregate shelters in feeding individuals? And then, of course, working with your non-government agencies and private partnerships. I've always said that you need to start having these conversations now. Everyone in emergency management knows that you have those conversations way before disaster, that you trade those business cards, that you meet each other, that you have those phone conversations and talk about how you can all help each other in this. Because again, COVID has really stretched things thin here in Texas. And we will be asking, local jurisdictions, really look at what you can and cannot commit to. How will you take care of not only, your own residents, but residents that may come to you looking for help. Identify where your shortfalls are and let us know so we can start working on that. Next slide, please. And, going on that, we talk about feeding. We'll talk a little bit about the feeding task force. The feeding task force is made up of many organizations you see on the slide here that get together and talk about how we will feed in the state of Texas. Now, all emergencies are local, so I encourage you to reach out to your local VOADs and start having those conversations. If you do have a shelter, if you have a congregate or non-congregate shelter going on, identify what those feeding options are. What other, what does the capacity look like? What can they feed? Will we have to bring in other vendors? Will you need to outsource to different restaurants or a restaurant association in your area so that you can make sure that you, identify that beforehand? Planning is not going to be easy this year. We do know that non-congregate is not going to be the only solution. It's going to be a solution. It's going to be one of the solutions that'll help you, but you need to be planning for the non-congregate congregate area. Not only in cities that individuals will evacuate to, but those coming back to the coast as well, or those returning to their homes, really looking at what your capacity is on that. And then if we want to go to the next slide, I know planning is, sometimes difficult. Where do you start? I've put some resources on there for you to look at. If you look at the National Mass Care Strategy, they have a lot of best practices that put on there. They have some training courses you can go through about sheltering. If you look at the DSHS website under coronavirus, you'll see some guidance that they have just put out recently in the past couple of weeks talking about sheltering and sheltering options. And if you look on FEMA.gov and search mass care, you can see guidance that have come out to them, especially when it comes to sheltering square footage, especially in a congregate setting. With that, my contact information is there. Please feel free to reach out to me with any questions, comments, concerns. If you want to have a conversation about sheltering in your area, I'd be glad to talk with you. Thank you all for what you do out there, and thank you all for inviting me again for this presentation. Have a good day.
Thank you very much, Mario. I appreciate that. What a great panel, folks. We have run out of time for Q&A, though. So thank you for all that you do. We're going to go to break, and we'll have a short video from our generous sponsors, the Port of Corpus Christi and Citco. Cue videos.
Hello, I'm Sean Strawbridge, Chief Executive Officer of the Port of Corpus Christi. As the leading energy port in the nation, the Port of Corpus Christi has a very special responsibility of ensuring our critical infrastructure remains safe for all workers and competitive for all our customers. Our nation and our global allies expect and depend on us to deliver the energy they require to power the world. Thus far, we have delivered on that expectation. As national critical infrastructure, the Port of Corpus Christi is vital to our nation's economy and our national security. Over 1 million workers' livelihoods are dependent upon our ability to remain open for business. Therefore, in early March, we instituted all COVID-19 protocols, including social distancing, health screenings, and work-from-home practices in compliance with CDC directives and orders issued by Texas Governor Greg Abbott and Nueces County Judge Barbara Canales. As we combat the spread of this global pandemic, our incident management team continues to work in close collaboration with our partners, including the U.S. Coast Guard, Customs and Border Protection, and the Nueces County Department of Public Health. We continue to coordinate with our elected officials on a business recovery plan designed to ensure that we get the coastal bend back to work and the wheels of commerce turning again. We continue to support our healthcare professionals and first responders through the distribution of meals. And most recently, in partnership with HEB, we coordinated the distribution of over 1,000 gallons of hand sanitizer to first responders and area hospitals. As we support these hardworking women and men who are truly on the front lines of the war on the novel coronavirus, we are deeply grateful to them for their selfless and brave acts to protect our community. Right here at the Port of Corpus Christi, I'm so incredibly proud of all of our port staff, and I offer all of you a heartfelt thank you. All port staff have demonstrated an unwavering commitment to slowing the spread of COVID-19. Therefore, I commend you all for your sacrifice and dedication to keeping the Port of Corpus Christi safe and operational in these extraordinary times. Whether in calm seas or troubled waters, we are resilient, we are united, and together we are port strong. I thank you. Stay safe and healthy.
everybody, and welcome back to the 2020 Coast of Bend Hurricane Conference, a pandemic approach. We're so pleased to have you stay with us for this ongoing important discussion. I'll be moderating our third and final panel, and we're going to discuss virtual coordination. This past 6 months has been a really significant transition for many of us. We're accustomed to jumping in a vehicle and zipping from one meeting to the next. The idea of telecommuting is definitely not a new concept, but many of us did not do that on a regular basis. Much of what makes emergency preparedness successful are our relationships. The exchange of business cards or breaking bread before disaster helps to ensure our success. Many of our organizations have emergency operations centers where our teams come together physically to coordinate and collaborate. The National Incident Management System and the Incident Command System are all built on the concepts of physical facilities to manage our emergencies. Now that social distancing and technology are the new norms, how is that impacting our operations? What is your plan for a major emergency, such as a hurricane, when access to technology may be limited? Have your continuity of operations plans kept up with the fact that you're already in a coop? And now that this COVID is with us, you now have the potential for another disaster within your disaster. So our next panel of experts that we've invited will share with you how technology can continue to support the planning and response efforts for your organization. All right, we're checking audio real quick. If you would just give us a moment. Testing 1, 2, 3, 4. Are we back up? All right, everybody, if y'all just hold tight, let us get us back into a better audio situation.
Danielle, this is RJ. I can hear you. There is a robotic echo, but I can still make out what you're saying. So if we can't fix it fairly shortly, I would recommend that we continue on with the poor audio.
Thank you, RJ. How's the audio now?
It's still the same, but I can understand the words coming out of your mouth.
Okay, we're going to give it one last try. How do I sound now?
I hear you loud and clear. Excellent.
Excellent. Okay, thank you, everybody, and I appreciate your patience as we work through this. I think literally I was talking about making sure that we have good continuity of operations plan and making sure that we have good continuity of operations and being able to adapt and overcome. So thank you again for all your patience. So I'll go ahead and jump into our panel introductions. First, we have Ms. Sarah Williams. She is the Director of Emergency Management and Safety for San Patricio County. She's been in her current position since 2017 and has led the county's recovery efforts from Hurricane Harvey while redeveloping the multi-jurisdictional emergency management program, or their personnel safety program, and the floodplain management programs. She's over 17 years of experience in emergency management and GIS in various levels of government and in the private sector. She has a degree in emergency administration and planning and a GIS certificate from the University of North Texas. Next up, we'll have Mr. Joe Schuman. He is the chairman of the Coast of Bend Healthcare Preparedness Coalition. He's been with the Driscoll Children's Hospital for more than 21 years as its security director, and he leads their emergency preparedness programs. During Hurricane Harvey, he served as the incident commander in the hospital's command center, and Joe has been involved in related fields for more than 30 years. Next up, we'll have Mr. Lee Otten. He's the Protective Security Advisor for Region 6 of the Department of Homeland Security's Cybersecurity and Infrastructure Security Agency in Austin. Mr. Otten supports liaison activities amongst CINSA and other federal agencies, state and local governments, and the private sector on security-related matters and for the protection of nation's critical infrastructure and assets. As a PSA, he's the federal focal point of contact for infrastructure owners and operates, and meets regularly with site security personnel and officials to share information, review protection plans, and identify requirements for protection support by CISA and other federal agencies. Last up on our panel is Mr. Jeff Newbold. He's the Chief Technology Officer for the Texas Division of Emergency Management. He oversees the technology of the agency, its enterprise architecture, and leads the operation technology efforts for development and delivery of solutions, including geospatial information, critical information systems management, and traditional information technology direction and support. Prior to his role, he served as the state coordinator for critical information systems and has supported response and recovery of all state level incidents since joining TDM in 2013. Prior to his time with the state, he supported all incidents since 2005 as part of the Alamo Regional Command Center in San Antonio. So again, thank you all for joining us, our panelists. So we'll go ahead and get started. Sarah, you're up.
Good morning, everybody. Thank you for having me. Danielle, thank you for the great introduction, and I'm glad to be here today. And this last few months has definitely been interesting in learning and having to change with our environment and use tools that we may not be used to and we may not be familiar with. So talking on the challenges and successes as well with virtual coordination. Go ahead, next slide. So just the summary of it, you know, Danielle asked me to come and talk today, not only as an emergency manager, but as a GIS professional. And so with GIS, with Geographic Information Systems, or GIS, we continually try to gather information from varying sources to be able to give a picture of what exactly is going on in the moment and to be able to help communicate the overall situation of what's happening during a disaster, and also to be able to help show what possibly may be coming as we move through that disaster. From a virtual standpoint, it gets a little difficult sometimes because we're getting things from all different directions, and there we have some technology challenges and some understanding challenges. And then also with adopting and deploying of different virtual response platforms, there's a lot of different technologies and things out there that come into play. Everybody has their favorites. Everybody has ones that they're more familiar with. But in the midst of response, it's a matter of using the tools that that work for what we need. And then I wanted to touch also on team dynamics in these virtual response scenarios. It's definitely a very different type of response than what a lot of us are used to. So go ahead, next slide. So first I'll talk about using GIS in a virtual response. One of the biggest challenges is being able to get things in either real time or near real time, and to be able to communicate that to your stakeholders, your teammates, and also to the public. Thankfully, with the advancements in GIS over the last decade, we've been able to have a lot more tools at our disposal than just a paper map that we hang on the wall. So there's online mapping tools. There's the ability for us to go out and collect data in the field with anything from a cell phone to other computer systems, as well as drones and all kinds of other inputs that we can use to collect data out in the field. This allows us to be able to have a better situational awareness, to be able to see more of what's going on, and to be able to communicate that well to others. One of the great things, and I'll give a little plug to a group that I'm fond of, and that is the Texas Texas GIS Emergency Response Team. And this is a group of individuals that started up in the North Texas region, and they have come together and started to utilize a lot of these online mapping tools and a lot of the tools that have been created over the last decade or so to be able to employ their spatial friends across the state to come in and help them collect data, edit data, and get things set up so that they can be turned around in a more timely manner. For example, in the floods in 2018, they sent out a call amongst all of their membership and asked us all to see if we could help edit some data and get it back to them so that they could get it back up. And it was as simple as they emailed me a link, and I was able to go on and edit the data and clean it up and make sure that it looked like it should and said what it needed to say, so that those folks that were there in the midst of responding to the flooding would be able to have what they needed and be able to communicate their needs and their issues in a timely manner. Also, the use of the online mapping platforms allows us to communicate to a pretty broad audience, and people can get things on their cell phones, on a laptop, or through a regular browser on a computer. And they can use the platform that they're comfortable with, and we can show them the information that we feel that they need to know at the time. And that way it's, you know, from everything from right now with COVID-19, where's the closest test site to me? How do I get there? They can go onto this website, and the website that the Department of State Health Services has set up, and find the closest testing site to them and be able to get directions on how to get there, and be able to help communicate that with their friends and their neighbors as well. GIS is a very powerful tool in response, and it is ever changing. And I think from the virtual standpoint, it's just going to keep us moving forward more and more. So go ahead, next slide. In this response to COVID-19, we had the challenge of not necessarily being able to bring everybody together in one room, which is what we're used to doing in an emergency operations center. We had to take into consideration the exposure that we would have with having all these people in one place. And so we've had to change the way that we operate. We virtually coordinate every day by text message, emails. You know, our departments within San Patricio County aren't all housed in the same building. So it's not unusual for us to communicate with each other through these means of these basically virtual means, where we're not in the same place, we're not face to face. Though we had trained over the years that that's how we were going to do things, that we would be in that room together and that we would be face to face with each other when we were in the middle of a response. So we had to back up and change our tactics a little bit as to how we're going to communicate with each other. We still had to do a lot of the same things that we already do, and that set our pace as to how often we're going to do things, that battle rhythm. We had to define how we were going to communicate and on what platform we were going to communicate. There's all kinds of different virtual emergency operations center platforms out there. And pretty much all of them function fairly similarly. They just use different bells and whistles, different buttons and things like that. So it's a matter of figuring out what works best for your organization. And I will tell you that the varying levels of ability and experience has been one of the bigger challenges. Those folks who struggle with technology are going to struggle with technology in this virtual environment. And you just have to be aware of that and make sure that you know what platform you're going to use for a virtual response prior to something happening, and try and get everybody as familiar with that as you can prior to an event, so that you don't have such a hard startup to get everybody comfortable and moving forward. And then of course, with all of these platforms, you're able to get lots of dashboards and information, see things in fairly real time or near real time, and be able to just bring in all kinds of data. You got to be careful though that you don't end up in a data overload, because you can overpower people and give them too much, and then they just don't know how to sort it out. So you have to break things down into more manageable and bite-sized pieces. Go ahead, next slide. And then just to touch on how it changes your team dynamics. We've had some pretty funny instances where we're having to learn and work our way through phone call etiquette and not talking over each other, or knowing whether you're muted or not, or whether the camera is on while you're on a webinar or on a call like we are today. And then sticking to your script or agenda. It's hard enough to keep order in a meeting when everybody's all in the same room, but when everybody's in different places, you have to make sure that everybody knows the agenda and that you continue to work your way through it. Otherwise, it just becomes chaos within your own meeting. And I will say that visual aids, and not just maps, but any kind of visual aids that you can use in this environment is very helpful, because people aren't necessarily able to be there to see your facial expressions or what you're pointing at or anything like that. So it's really helpful in that virtual environment with your team to make sure that you have something that they can see to help communicate your overall message. And that's all I have for you today. Thank you for having me. And here's my information and some resources where you can find out about some of the things I touched on.
Thank you, Sarah. We appreciate you and all the hard work your team is doing. Next up, we have Mr. Joe Schuman.
Thank you very much for the opportunity to speak today. We'll talk about the Healthcare Coalition and what the coalition is really all about. The mission of the Healthcare Coalition is encourage collaborative healthcare, community planning, emergency preparedness to virtual and man-made disasters affecting the coastal Bend region by providing an aligned forum of persons, businesses, health entities, and response agencies from within and the surrounding area. The Healthcare Coalition's primary responsibility is improve the surge capability by enhancing community and healthcare preparedness for public health emergencies, assist facilities with preparedness of public health emergencies in the Coastal Bend region by implementing and reviewing a comprehensive preparedness and response plans, and to serve the healthcare delivery systems and public health needs to the region in the event of an all hazards of disaster. To evaluate and make these recommendations supporting operations involving the Healthcare Coalition. The coalition is a group of multidisciplinary individuals. You got hospitals, long-term care facilities, rehabilitation facilities, city and county public health, EMS services. You've got both urban and rural, education community, at large individuals, and then also the emergency management representative in their emergency management community. The coalition's specific responsibility includes in advising the members on matters regarding to the healthcare facilities pertaining to healthcare systems preparedness in the trauma region, review healthcare systems regional response plans, work to achieve healthcare preparedness capabilities, performance measures, and to maintain minimal levels of readiness. The participating with planning, the exercise, and training workshops, which is what we're doing. Monitoring progress of each capability as described by the Office of the Assistant Secretary of Preparedness and Response, which is ASPR. Develop and sustain improved regional preparedness and response projects related to healthcare. Coordinate with local, regional, state officials and our jurisdictions, planning efforts in the healthcare community. Identify and develop gaps in planning, resources, education, and training. Develop action plans to support educational opportunities to facilitate, integrate with local, regional, and state response parties. Assist in developing, educating, or the execution of exercises, drills based on identified needs and issues, formulate corrective action plans, and perform follow-up measures to ensure best practices have been instituted. Ensure sustainment of medical coordination through support of the Region 11 Medical Operations Center. Coordinate planning with response partners of unique needs of special medical population and at-risk individuals. Disseminate planning and response initiatives. Provide, receive guidance and recommendations to and from subcommittees, ad hoc committees, or planning initiatives, program developments, and grant expenditures. Hurricanes always supposed to be a problem in our community, but with this time of the COVID-19, the challenges are even greater. During the time when a hurricane threatens our area, first of all, we talked about communication. First of all and foremost, you need to activate your incident command center so you can start communicating with the outside area, and have seasoned staff that can communicate. Always have multiple layers of communication built into your plans. Secure, well, it sounds strangely enough, but it's the security of your parking structures, because you'll find your neighbors are all parking in your facility, and once your staff arrives to report to work, your structure is already filled up with your neighbors, and this is just causing more anxiety from the start. Communicate with hospitals outside of the affected area in case the inpatient evacuation is required, since some facilities might not be accepting patients from the area due to COVID-19. I think this was already discussed earlier. Relocation of patients and families need to be considered early on. How will patients be transported? Will the families be transported with them, because some families arrive to the healthcare organizations without transportation? And what if the family is COVID positive, and that communication, how will that be at? And how will you transport those COVID positive patients, if you can transport them at all? And the pediatric world with the Children's Hospital, a lot of facilities don't like to receive the little guys that we have because of the special needs that they have. So it's something that has to be considered, and that's why you just start your communication early on. Your relocation of your staff with the patients will be sometimes necessary to meet the needs of those individuals, such as your dialysis patients, your vent dependents, your special needs patients, and even sometimes for the pediatric world, you have CPS, Child Protective Services involved, in which the children have been removed from their parents and are their biological parents, and you have to meet those needs as well. Have some well-established Team A's and Team B's, and always keep the personnel on site for the essential needs of the patients. Too many people just increase your risk level. During the last hurricane, we actually ended up with a couple of pregnant employees on our Team A, which during the hurricane, Hurricane Harvey, they went into labor and had to be transported to another facility so they could go into labor and delivery unit. Facility preparations are always of a need. You need to have adequate food and water for the staff, patients, families, and emergency responders such as police, fire, EMS. We actually provided meals to the law enforcement and EMS personnel in our area during Harvey, since we had adequate food for them. So we talked earlier about sleeping quarters and shower arrangements. Talk about generators, all this generation of fuel with potable water on site. This is all part of the stuff that you need to make sure that you start coordinating well in advance. I know the PPEs have been an issue. Have adequate hand sanitizer and cleaning supplies on hand. Should you find yourself with a positive COVID staff in the hospital, do you have an area identified for self-quarantine? I know the PET policy was talked about earlier, and making sure that your staff is aware that you do have a policy and that there is somebody in charge of that. That way it kind of reduces the anxiety of that employee. I know the trials of not having electrical power at the last hurricane in some communities. Individuals are trying to get into the hospitals to recharge their medical equipment. Do you have that capability that you can assist? Will there be medical shelters established in the area? So following a hurricane, though, and attempts to reopen, post-storm, a facility needs to be in a recovery mode quickly, and such things as debris removal and damage assessments need to be done. Work with available contractors, utility companies, and vendors. Establish written agreements if at all possible. Need to have cash on hand. It sounds strange, but now I'm talking about not using the hard currency, but sometimes our contractors don't want to start work until they have money in hand before they even conduct any type of work. Keep accurate records on staffing, expenditures, both on-site and off-site. How will you get your patients back to your facility when you become operational again? Sometimes receiving hospitals don't like to return to patients, so you have to negotiate those agreements well in advance. Have plans on how to get your team be back. Make sure you've got your tier 1 essential personnel reentry letter in place with required documents. How would you handle the staff returning from an area that has the exposure of COVID-19? Do you have on-site testing capabilities? Remembering the coalition's leadership provides real-time situational awareness and current conditions, bed counts, equipment availability, and identifies unmet needs, as well as services as a liaison for the local, state, and federal partners. All unmet needs, I believe that was discussed also, should be submitted to the RAC to be evaluated, and those needs need to be looked at locally first. After that, a STAR request could be submitted, but that's after all your resources have been exhausted locally. Know your emergency management coordinators in your city, your county. Make sure you know who they are and you communicate with them. Get involved with the Healthcare Coalition, participate with the local emergency management organizations, both in the city and the county. That's all I have, and thank you very much, Danielle.
Thank you, Joe. We really appreciate you and all the great work that Driscoll does in all of our healthcare facilities. Next up, we have Mr. Lee Otten.
Good morning. As Danielle said, I'm Lee Otten. I'm the Protective Security Advisor for Region 6, covering the Coastal Bend with the Cybersecurity and Infrastructure Security Agency, otherwise known as CISA. Next slide, please. So for those of you that aren't aware of who is CISA, or the Cybersecurity and Infrastructure Security Agency, we are a voluntary, non-regulatory, non-law enforcement agency that our goal is a secure and resilient critical infrastructure in our nation. You know, how do we do that? We do that by understanding the risk and helping owner-operators manage that risk. And owner-operators being the public sector, private sector, you know, and I think most of you are aware that close to 90% of critical infrastructure is owned, operated by local, state, and private entities. So the federal government owns very little of that critical infrastructure. So how do we manage that risk? Well, we develop private-public partnerships and understand that risk and work with organizations such as the Port of Corpus Christi to identify vulnerabilities and to identify measures to mitigate those vulnerabilities. Next slide, please. So today what we're going to talk about is we're going to talk about just some of the challenges in this new environment. You know, with teleworking, you know, some of the opportunities and challenges that provides, you know, the vulnerabilities, and then we'll also talk briefly on community lifelines. The FEMA recently revamped the National Response Framework. Next slide, please. So, you know, with the rapid increase in adoption and deployment of video conferencing and other collaboration tools, it's allowed our cyber adversaries more vectors for attack. They haven't changed their attack vectors. They just have more opportunities now. So, you know, nation states to transnational criminal organizations are seeking to collect information on research and development. And in particular, in this environment, they're attacking healthcare sector. They're attacking the pharmaceutical research industry. They're trying to gather information on any of the research that is being done on vaccines and mitigation measures for COVID-19. They seek to gather critical infrastructure information. If it's a nation state, they're gathering and they're collecting that information, waiting for a time to use that. It may be during wartime, it may be during, you know, it may be during an economic calamity, or maybe during some sort of incident where they're trying to shut down critical infrastructure operations in our country. You know, or they may be gathering personally identifiable information, especially with the criminal organizations. So how do they do this? They do this by actively exploiting vulnerabilities in client software. They exploit communication tools to eavesdrop or take offline. You know, they use denial of service. They do Zoom bombing or hijacking video teleconferences. You know, that's I'm sure people are familiar with that. It was happening to schools where actors were inserting pornographic images in school videos or school video conferencing. They may be put up, you know, political language or hate language. You know, another option is they can compromise remote desktop applications or your managed service providers. They attempt to penetrate sensitive meetings. You may have as we move more and more to teleworking, you may have sensitive organizational meetings amongst your executives, amongst your operations, and you're handling that virtually. So if they can penetrate that, they can potentially gather or collect information. So what can you do? You know, at an enterprise level, you want to establish organizational virtual meeting policies. You want to limit and minimize the number of collaboration tools authorized for use. Develop an authorized list of approved video and collaboration tools. You want to prohibit end users from installing client software. As Danielle is aware, I had an issue with Zoom, the Zoom client, and doing this meeting on Zoom because of my organization. So I had to get approval from our Office of Chief Information Security to install the client so that I could present it on this conference. You want to prevent users with administrative privileges from using collaborative tools while they're logged on as administrators. And you also want to prohibit the use of collaboration tools and features that allow remote access and remote administration. For end users, that's every one of us, you want to only use those organized, approved software and tools. You want to adjust your security accordingly. So if you're running the meeting, you want to make sure the meetings aren't public unless the intent of the meeting is for the public audience. For private meetings, you want to require meeting passwords. You want to provide links to the meeting directly to specific people and share passwords in separate emails. You want to consider the sensitivity of the data before exposing or sharing. When you're joining outside meetings, such as Zoom or meetings initiated by other organizations, you don't want to install that software. You want to join, you can do a web-based session and join using your browser. The other thing, a lot of us have virtual assistants. You have Google and Siri and Amazon, I'm not sure, what is it, Alexa? You want to disable those. You want to make sure your home security cameras are turned off, especially if you have information that could potentially be captured that is also sensitive. You know, there have been incidents where critical infrastructure sector facilities have done news conferences, and they've had pictures of their operational control networks and screens up behind them that allowed attackers to identify the systems and the ICS systems and control systems they were using, and then exploit known vulnerabilities in those systems. You want to check and update your home network. The one thing that as we go to teleworking, your IT department does not control your home network. They're relying on you connect through the network you've established through your internet service provider and whatever equipment you may have. So you want to check and update your home network. You want to change the default settings on your broadband and Wi-Fi routers. I don't know if anybody saw, US CERT just came out at the end of June with a list of router vulnerabilities in Netgear. So Netgear is a very popular home Wi-Fi router, and a lot of them have some pretty severe vulnerabilities. So you want to take a look at those, not just Netgear, but your own home router. You want to make sure you have the most recent firmware, and you also want to replace end-of-life devices that are no longer supported with security patches. Sometimes that's more difficult to do. It's easier said than done, because a lot of times these organizations, companies won't tell you that they no longer support a particular device. So if it's several years old and you're not getting any firmwares, it may be close to end of life. So next slide. Let's see. So what are some of the opportunities some of the opportunities of teleworking? A lot of organizations are finding that, especially if they have employees that can telework or functions within their organization that can telework, they're finding they're getting improved production or efficiency. They're also finding lower expenses. There's an organization here in Austin that was in the process of either building a new office building or identifying more space to lease when the pandemic hit. And so they started teleworking, and they provided a stipend to their employees to set up home offices, and they were still saving money due to reduced carrying costs in their office buildings and reduced utility costs. They didn't have to have security at the building as much, so they are offsetting some of those costs, and they don't have to build a new building or lease new commercial space. Some of the disadvantages, as we mentioned, is that the corporate IT doesn't manage the home network. And working from home can be challenging. I'm sure everybody here has had those interruptions at home in the middle of meetings, especially if you have young children. Big disadvantage is that you never get to leave work. You're always at work if you're teleworking. And then as humans, we're social animals, and I think many of us prefer that in-person interaction versus virtual, so it can be very difficult and trying. It can also be rewarding. It's more flexible, and you do get to spend more time with your family and kids. And provided that your work organization allows you a little more flexible schedule like teleworking, it can be. You can have a lot of good opportunities. It can be very beneficial. So next slide. So I know this one's near and dear to Danielle's heart, but FEMA, updated the National Response Framework recently and identified 7 community lifeline sectors. What are these community lifelines? In short, community lifelines enable the continuous operation of critical government and business functions and are essential to human health and safety or economic security. They're the most fundamental services in the community that, when stabilized, enable all other aspects of society to function. So the construct of this community lifeline is an objective-based response that prioritizes the rapid stabilization of community lifelines after a disaster. So when these community lifelines are disrupted, decisive intervention is required to stabilize the incident. And that can either be through rapid reestablishment of that lifeline or implementing contingency operations. So why did FEMA go to this community lifeline? It used to be, I'm sure you all are familiar with the WETC, or the water, energy, transportation, communications. That used to be the lifeline sectors. So why did they go to this? Why did they change it and go to this? Well, they're trying to reframe incident information so they can understand and communicate, or we as emergency managers, incident response, can understand and communicate incident impacts using plain language and promote a unity of effort across the whole community, prioritize efforts to stabilize the lifelines during incident response. So it basically is trying to help us communicate and talk on the same language. So on that, as emergency managers, do you know the top 3 to 5 community lifeline facilities that are critical to your area of operations? Do you know what facilities are dependent on them? Do you know what facilities they depend on to maintain operations? I'm sure you can hear my timer not canceling. That was my 10-minute update, but it will not go off. So you know, who do they depend on? And do they have critical supplies that they require? And are they impacted by transportation disruptions? You know, so, and then as mentioned earlier by the previous speaker, do you know the points of contact of these facilities? Do you know, can you anticipate in advance what they're going to need during an incident? So, and then I think last slide. And these are just some of the resources. CISA has lots of resources available, lots of guidelines. You know, so we talk about the best practice in teleworking. There's a whole section on teleworking. So you don't have to recreate the wheel. You can pull those documents and you can take them lock, stock, and barrel and make them your own, or you can adapt and improvise for your own operations. That's all I've got. Thank you.
Thank you, Lee. We appreciate you joining us today and all the good work that your agency does for our critical infrastructure workers. So next up, we have Jeff Newbold. Are you with us, sir? So we're going to give it just a second for Jeff. We're having a couple of issues getting him back online. Jeff, are you there?
I am here.
There you go. I knew you'd get there.
Yeah.
Thank you and welcome, sir.
Thank you very much. Sorry about that. Let me just jump right on here. Good morning, everyone. I would like to thank you for virtually attending today and for bearing with me with that technology as we have had some challenges this morning. I'm working with Zoom right now to get this slide rolling. All right. One more second. Okay, let me see if I can get out of full screen here because that is blocking me. I've got it 3 times. All right, there we are.
We don't know what you see, but you look great.
Thank you. Oh, you don't. I see Zoom 3 times. Anyway, so today I'm going to briefly go over our data sharing capabilities, which include WebEOC and our common operating picture, and how our current response has given us the ability to expand to address non-governmental organizations in the near future. We know from past events that our NGOs have a huge support in Texas, and this COVID response is no exception. I also hope that, like our evacuee tracking network that's been mentioned a few times this morning, that's being used by other states, some of the solutions that I'll show you today can be shared as well. Next slide, please. Our common operating pictures are key to allowing our decision makers to have fast, high-level information as needed. In Texas, we have common operating pictures for response, recovery, and daily operations. As an incident grows, we currently learn of other data capturing groups that need to be tied in. One example during the Harvey response was our regional Texas EGRT team that TDM needed to tie into our state-level GIS data. And that was very easy to do since we were on the same platform. You can go to the next slide if you'd like. However, if we cannot consume it as easily, then we turn to WebEOC as it allows for virtually all types of data, and it allows us to pull in feeds from anything, which then we publish into our common operating pictures. That always is going to be where we want to have everyone focus in one specific place. Go ahead. What you're looking at here is one of our common operating pictures right now, focused on COVID-19. But as you can see from those tabs at the top, there are a lot more information sources that we use during daily operations and right in the middle of a response, because hurricanes are going to happen whether COVID happens or not as well. Next slide, please. The State of Texas Assistance Request, or STAR, is our primary means by which local jurisdictions here in Texas can ask for, and in some cases, fill requests themselves made by local and regional partners. When the state or federal government is needed, STARs can be pushed up to the appropriate levels. You're looking here at a screenshot of our STAR board in WebEOC today. I'll note that before COVID, we had only generated around 80,000 requests in the STAR process, and as of yesterday, we had already hit the 120,000 request mark, most of those being COVID related. And again, having all of this data in a single place allows for decision makers to know the need and what is or is not being filled. We've found that when requests are made outside of the STAR process, that data isn't easily captured, and that can create a challenge for us. Next slide, please. So how do we fix that? Currently, as I had mentioned, only jurisdictions in Texas can make requests on behalf of their jurisdiction. COVID has shown that many NGOs need that ability as well. Because of that, we are well on our way to developing the STAR ability to submit to local jurisdictions. As you can see here, this website will allow for just-in-time video training for making those requests as well. Next slide. This form would allow a nursing home, a hospital, or even a local startup for an incident to request assistance through the proper city or county. Each field will have a prompt as well that needs to be filled so that the request will be correct. Once submitted, these notifications will be sent to the proper points of contact for a jurisdiction, their district coordinator here in Texas, and the Texas State Operations Center as well. Next slide, please. Finally, we will be turning on an online portal for all jurisdictions within Texas soon so that they can have a single place to go to during an incident, but also for daily operations that will give them a one-stop destination for all things TDM related. As we build this portal's capabilities out, additional products will be tied in that are capable for the agency. And what you're looking at right here is the initial jurisdictional login. And once they log in, that top left area is our 147, which captures critical information for each jurisdiction so that they can communicate data back to the state. I'll close with this. While COVID has challenged us to explore technology solutions that are opportunities that we have known, we've needed these things for a long time. The requirements needed to allow social distancing have forced us, I guess you could say, to expand our capabilities of data sharing and virtual situational awareness and collaboration. These capabilities will only grow into other types of response and preparedness, such as hurricanes. Let's all have a safe and socially distanced response when and if needed here in 2020. Thank you, Daniel.
Thank you, Jeff. I appreciate you joining us today. For those of you that are still with us, we're going to move past the panel Q&A. We're coming up close to the end of our time with you all today. As a reminder, this event is being recorded, and the recording of this and the presentations will be posted. We've gotten a lot of questions come in through that. So if any of you do still have questions, please put them into the chat function, and we'll make sure that they get addressed after the conference. To wrap this up, I have the honor to introduce our final presentation. With all the challenges that we've had in front of us, it's also very important for us to remember some of the great work that we've done in this region. In 2015, in response to flooding in Nueces and Jim Wells County, the Coastal Bend Disaster Recovery Group, or CBDRG for short, was formed by a dedicated group of community leaders wanting to establish a sustainable organization fully dedicated to long-term recovery. Prior to its creation, recovery efforts in our area started from scratch each time there was a disaster, which caused significant delays and limited funding for the survivors. When Hurricane Harvey struck in 2017, CBDRG was well suited to take on the challenge. So first up, we have a short message from Courtney Goss. She's the Texas Division of Emergency Management Voluntary Agency Liaison for the Disaster Recovery Task Force. And then after Courtney, we have Christopher Brandt, who will highlight the work that CBDRG has done to support our long-term recovery from Hurricane Harvey and what is needed for the future. Christopher serves as a Disaster Case Management Director prior to taking over as Executive Director earlier this year. Thank you to both Courtney and Christopher for joining us.
Hello, I'm Courtney Goss, State Voluntary Agency Liaison on TDM's Disaster Recovery Task Force. Long-term recovery groups are essential to your community's recovery from disaster, both physically and emotionally. It is important to remember that long-term recovery is a process and not an event. Every day is a recovery day. Having the structure, organization, and personnel in place pre-disaster that can think clearly when under pressure, that can manage people and donations, that understand their best practices and lessons learned, are vital to ensuring that those within your community that will not recover on their own not only have the opportunity to recover, but to do so in an organized, vetted, and more efficient manner. Having this pre-established trusted group like the Coastal Bend Disaster Recovery Group that in blue skies can build capacity, maintain community relationships, and prepare for the next disaster is crucial to effectively accomplishing your community disaster recovery goals and making our communities more resilient.
Good afternoon. Good afternoon, everyone. My name is Christopher Brandt, and I am the Executive Director for the Coastal Bend Disaster Recovery Group. Next. Next. CBDRG's mission is to strengthen regional long-term recovery by addressing and jointly resolving unmet disaster-related needs of individuals in the Coastal Bend. Next. In October of 2015, CBDRG was founded in response to flooding in Nueces and Jim Wells counties. May 2017, CBDRG concluded its response to the flooding in 2015. 3 months later, Harvey hit the Coastal Bend. Within 2.5 months, CBDRG hires its first group of disaster case managers, and 3 months later holds its first joint unmet needs roundtable. By June of 2018, the National VOAB disaster case managers start working in the Coastal Bend. By the anniversary of Harvey, 215 cases were approved through unmet needs, and $5.9 million was obligated. And there was 31 home rebuilds and 41 MHU replacements that were also obligated. Next. What is an unmet need? An unmet need is a basic need that is disaster related and the survivor is unable to obtain because they lack either part or all the resources to obtain that need. Next. Cases are presented to the unmet needs roundtable when all of their options have been exhausted for the survivor's recovery. Unmet needs is the survivor's last chance for help. Unmet needs roundtable helps to bridge the gap between the resources the survivor has available, the resources needed to complete the survivor's recovery. Unmet Needs Roundtable is a coalition of the willing that brings donors, funders, people power, and other resources to one table to coordinate a survivor's recovery. Next. Why do funders and agencies need to cooperate and coordinate? Because of restrictions and limitations. Funders or agencies may be restricted to a particular county or city. They may be restricted to the type of resources that they can provide or the amount of money that they can provide on a single project. Each agency brings its own uniqueness and expertise. The secret is to coordinate so that it can be leveraged to improve the quality and quantity of the response. Next. In this example, a survivor received major damage due to a hurricane. The roof has been leaking and damaging the interior walls and insulation. The survivor received $1,000 from FEMA. They're on a fixed income and they were not insured and they are unable to pay the $12,000 to replace the roof. The survivor only has $400 of their own money to contribute to the recovery. Next. Funder A is able to pay for materials, but is unable to pay for contracted labor. Funder B can pay for the labor and materials, but they're restricted to only pay a maximum of $8,000. Agency C is unable to pay for the roofing, but has a volunteer and resources to fix insulation and drywall. Next. Through cooperation, the survivor contributes their $1,000 they receive from FEMA and $400 of their own money. Funder A contributes $4,800 to pay for the materials, and Funder B contributes $6,800 to cover the rest of the money. Agency C agrees to repair the interior drywall and insulation. When the agencies work together, it becomes problem solving instead of a competition. Next. This is a list of some of the partners that have come together through the unmet needs table. All of these people and all these agencies have been instrumental in providing the recovery for the Coastal Bend. Next. Here's some of the major supporters that have also come together to help the Coastal Bend through CBDRG's unmet needs table. Next. To date, the coalition through unmet needs has funded 344 major home repairs, replaced 146 manufactured homes, rebuilt 92 homes, and approved a total of 649 projects with $18.9 million in obligations. Next. Here's some contact information if you're interested in the Coastal Bend Disaster Recovery Group. I've shared with you some of the really impressive numbers that the coalition has helped in the Coastal Bend. I'd like to share a little video with you on some of the lives that have actually been touched through the generosity of all the volunteers, all the corporate sponsors, and all the agencies who've all come together to help these families recover from Harvey. Thank you. Next.
I would like to thank all the moderators and all the folks that moderators, the speakers, the panelists for their participation and their insights this time. I'd also like to thank the audience members for joining us and the sponsors for their continued support. Another area I'd like to talk about is just a reminder that that we will publish any of the Q&As along with this presentation that we're unable to cover at this event. Some of the Q&A questions weren't able to cover attendees along with the presentation itself. All of this will be posted at the Coastal Bend Council of Governments website under the Homeland Security Department. Give us a couple weeks, hopefully to have it there sooner, but let us do that. I'd also like to thank just the whole crew, the planning crew, and Edelman Global Communication for their help in the coordination of this. Some of you may or may not know that the moderator for the second section was switched during the presentation. That was actually a contingency plan that we had in place. It was not Plan B. Plan B was what we started with today. That was Plan C, and we do have a Plan D. So continue your planning, continue for contingencies, ensure that you have all that. And once again, thank you. And this concludes the 2020 Coastal Bend Hurricane Conference, A Pandemic Approach.